Recording's on. All right, thank you. And this is Chairman Berlin of the Finance Committee. I'd like to call the meeting to order. Roll call, please.
Mike Berlin.
Here.
Laura Negro.
Here.
Blake Ellefson, he will be joining us. Pat Kinney,
Here.
Ron Stendor. Ron Stendor,
He's not here right now.
okay, well, that's everyone.
Thank you. Moving on. Approval of the agenda. If we had a chance to look at this.
This is Pat. I'll make a motion to approve.
This is Laura. I'll second.
All those in favor signify by saying aye.
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 Aye. Opposed, same sign. Motion carried. Item number 3, public comments. 3 minutes, please. Anyone online? You have anything, Gary? No? Anyone online for 3 minutes? Last call. Anyone online for 3 minutes? Thank you. Moving on. Approval of the financial minutes of October 20th.
I'll make the motion that we accept the minutes as presented.
This is Pat. I'll second.
We have a motion by Laura, second by Pat. All those in favor signify by saying aye.
Aye.
All right. Opposed? Motion carried. Item number 5, M3 Insurance.
Okay, we have Kristen Schmidt from M3 in the room today with us.
Perfect, thank you. I have some people that are going to come and just present on some of the topics we talked about last time. So I have Ross Viella on the phone. He is the owner of Alithya, which is the transparency tool we discussed. So he's going to run through this at a super high level. So just somewhere around the, 5 to 10 minutes, and then allow for questions. So Ross, are you on the phone?
I am.
Awesome, thank you. So Russ, do you just want to share high level about Alithya and kind of what you do for clients and what the county could expect?
Sure. So first of all, it's nice to be here. Thank you. I grew up right across the lake in Silver Bay, Minnesota. So it's nice to have someone up on that North Shore, South Shore area. I started Alithya about 10 years ago with the sole purpose of helping employees get the most value from their benefit plan. And we do this by educating them about their benefit plan design and guiding employees to the highest value providers and ensure that they pay only what they owe, that they understand any benefits related information that they've been given. And we assist them in finding lower cost prescriptions and when appropriate, negotiating medical bills to reasonable fees. And we do this across the nation. I started this company out in Milwaukee in 2011. And since then, we have over 150 client companies and serving over 150,000 employee lives or total lives. So, Kristen, is there more that you would like me to talk about in terms of background or?
Yeah, Ross, can you just talk through the, I have the list up for the Money 20. So this is the shoppable procedure piece we talked about. And this comes into play, you guys also. I have another meeting with the CEO for the hospital this afternoon. So we are continuing to have those conversations. I am going to say that I am hopeful by July of next year that we'll be able to have some bundled contracts and some really great things happening for this market. So that's my hope, right? So I'm working through that piece. But when we talk about the Money 20, these are really the shoppable procedures. So this is the main list that we work off of. Now there are standard incentive amounts. So I think that's something that you guys need to discuss as a committee, what you might want that to look like if there's any dollars we could use for incentives for next year. The reason we talk about incentives is that's really the way we get people to actually consider shopping and going elsewhere for their procedures, right? They see it as advantageous. Wait, I'm going to have gas money to go do that somewhere else and it's cheaper and it costs me less. You guys do still have a relatively low deductible for a lot of plans. And so that's the other thing that I think as we talk through this and can continue to build on this, we're going to want to think about and consider, because for people, they're like, well, it's $2,000. That's all I have to pay. They don't see what the county is paying, right? And so it's continuing that conversation. The other thing that Ross is offering with this service is it's actually more than just, well, it's all the pieces that he talked about, but for 425, so less than $10,000 annually, they will actually also be able to help employees understand their full benefit plan. So they will work with the TPA, BPA, they have a very good relationship with them. And so it will be something from a Heather perspective or a Dan perspective when an employee comes in and says, hey, I don't understand this part of my benefits. How can I do this differently? Or I have a question about a bill. They're going to be able to call Alithya's and work through all of those pieces. So it will also take some load off of the team here when it comes to those super detailed benefit questions.
So Kristen, can I step in for a second?
Yeah,
on this?
absolutely.
Because this is important, and I think this really resonates how Kristen and I, and actually IM3 have worked together around the state. And what we're trying to do is bring consumerism to healthcare. And our job is not to steer people away from the local healthcare providers. That's not our intention. However, when the healthcare providers have a monopoly on the employees, they have no incentive to reduce their costs or control the price in any way. So what we do is we educate the providers to say the employees now have better options and cost-effective options, and we want to go locally if we can, for as much as we can. But if someone has requires a knee replacement and it's going to cost $45,000 wherever they are, if it's in Houghton or Ashland or whatever, but I can get it in the Twin Cities for $23,000, that might be significant enough for the county to encourage the member to go to the Twin Cities, or perhaps even Duluth if the quality is high enough in Duluth. So what Kristen said is that we work with the local health systems to offer some bundled prices. And typically we would start with a mammogram or a colonoscopy or something pretty basic that they could do that wouldn't require your people to travel. But being up in Ashland, in some instances, travel may be required to find the highest value provider. We also have all the analytics for physician efficiency across the state of Wisconsin, including hospital efficiency. So even if we can't find the lowest cost, highest value, highest quality provider in combination, we can always steer to the highest efficiency or higher quality provider if all else is the same. So if someone were to say to me, look, I'm going to stick around this area, and that means I'm going to pay the $45,000 for the total joint. I'm not willing to drive to the cities. We can still get them to the better doctors, which would result in the long term in a better outcome for the patient.
Yeah, and I do think there's this great flyer that we'll send out to employees too, that just talks through the navigation team, how they can help, what they can help them with. And I do think it'll be a great way to start that education process, right? So what we find is that a majority of people don't even understand their benefits. They don't really know how to navigate it, what questions to be asking, how to make sure they're getting what they need. And so we really see Alithya's as our partner in that and giving us the ability to kind of take it to the next level for your employees. And truly yep.
So suppose there's two people on the insurance, a couple, there's a couple, one works for the county and they're on the county insurance, but the other isn't, they're on something else. Would the person not on the county insurance be able to get the same prices as the person on the county insurance?
So it will depend on the bundles and how they work. So like when we set up the bundles, oftentimes we're working with a company that kind of handles the overall majority. So it would matter if that person was on self-funded insurance or fully insured. It would matter, you know, it kind of all matters on how the navigation happens for those bundles and pricing. So we're gonna try to work on getting these bundles and different price procedures for your group and all the other belly buttons I have in this market, but it isn't necessarily going to be everyone. It would depend on where they were covered at.
So Kristen, I understood that question differently.
Okay, you go
Uh,
ahead.
So I just want to clarify, are you saying that you have a Ashland County employee whose spouse isn't on the county insurance, but is on some other insurance coverage? Is that what
Either,
you're?
either different insurance or maybe for some reason not insured. And I'm also thinking about, we've talked a little bit about, do we give employees some incentive to take a different insurance plan? Because
Right.
all things being equal, if other family members not on the county insurance plan could get the same price that you're looking at for the county employee, that would make this more attractive than otherwise.
Right.
So from a navigation standpoint, if we have someone who calls and says, I don't have insurance, we can help them with that. If they don't have insurance, if they do have insurance from another carrier, that's a little bit harder because I don't know the plan documents or the requirements of that particular insurance company. Because in some instances, for example, some insurance companies require pre-authorization or pre-certification. They may exclude certain drugs or certain procedures, or there are things that we just won't know about. So I'm a little bit hesitant to say we can offer them, real guidance. There would be a lot of qualifiers there around the price in that sense. Kristen is entirely correct in that if we're successful in getting these bundled rates, they should be able to purchase those bundled rates through other organizations, but that's really going to be up to them. We can make them aware that these things are available, and so they make them aware of the cash options that are available, which are becoming more and more important around ways to manage the cost and how that's administered through the claims adjudicator. So we have certain groups who are really encouraging the use of certain cash option providers and are trying to facilitate a much smoother way so they can submit those claims and get them covered for their deductible and coinsurance, which typically would take more time. But that's our goal, is to make sure that that ends up being a smooth operation as well.
So you mentioned the word bundle, so let me ask you this. Suppose my neighbor says, hey, I need my knee replaced, and I can see you can get yours replaced for 23 grand in the Twin Cities, but say that person on the county insurance, that doesn't mean the neighbor who's a non-family member could get that same rate.
In certain instances, they very likely could, but it would depend on who they're insured by and who that group is working with. So oftentimes what we see self-funded, there's an opportunity for any self-funded group to be able to access these bundles. But if you're fully insured, the carrier is they could pay cash, the $23,000, but my guess is if you're on a fully insured policy, that's not what you would choose to do. Like, you would choose to take whatever your insurance company is going to pay. So, yeah. And it's not, truthfully, if there are groups that you guys know that are self-funded in the market that we might not work with, I am happy to connect them with the people that we're doing these bundles with, right? It's much more important to me that people are getting good quality care at a specific price than it is for me to make sure they're all part of my business, right? So
Yeah.
I am happy to do those introductions and make sure that people are getting what they need. That is much more important to me than it is to make sure that I'm getting, it's all happening through us. That's not how I work. It's not how Ross works. So
Right.
we would happily do those introductions and figure that out, just make that connection for people. So, and I am working with another large employer in town and a large group of school districts as well. And we're working through some stuff for them that are in this market. And then there's another prospect I have in town as well. So those are all things that I would share with them, just because some of them are my clients, some of them are prospects, but that'll be all be information I would share. Yeah.
Hey, this is Blake.
Yeah.
One thing that's come up is there's a large merger potential between Essentia as well as Marshfield. Does
Yeah.
this should help us in Ashland County because ultimately the competitive pricing of what MMC has is what we'd call a monopoly now. But what do you guys see from our side on pricing and how that merger might help us?
Yeah, I think it's really interesting, Blake. So what I understand about that merger is that Marshfield is in need of some cash and Essentia is in need of a health insurance product. So it is kind of a match made in heaven. We do believe it's going to happen up from all the sources that I have. Obviously, I'm not sitting at that table, so I don't know that. I do think that it is going to create some more necessity around transparency on what things are being charged, right? What is the price? What are these pieces? And I do think it would open that door, right, for Essentia maybe to be like, oh, hey, what's happening over here? And allow for us to kind of create a little bit of healthy competition, right? It doesn't mean we can't give business to everybody, but can we create a circle where, hey, we know the knees and hips guys are in this town. Let's keep knees and hips here. Let's take, hernias and colonoscopy, whatever that looks like. But I just think there's an opportunity for us to do that. And I do think, Blake, that it will be healthy and it'll be healthy for this market to have that happen. But I think it's going to probably be a year and a half before it would actually fully flow through. So Ross, any opinion on that?
Well, I think we should look at what Marshfield has done in other markets, which are somewhat similar. I think Ashland County is a little bit unique because of the distance to other competing healthcare markets. So what Essentia does is it would expose a more competitive market in Minnesota, even though the Duluth Superior market is much higher cost in Minnesota than anywhere else in the state, simply because of the way their systems were set up. But I can tell you what's happened in Eau Claire, for example, in Eau Claire and Rice Lake, where I think, Kristen, we started working on projects like this 5 or 6 years ago. And I can tell you that Marshfield in the first 2 years basically said, it's nice to hear, but we're not interested. But then when they started losing a bunch of total joint replacements to Novo Health and Appleton and Twin Cities Orthopedics or Summit Orthopedics in the Twin Cities, they quickly came around, and the average cost of a joint replacement in Eau Claire went from $45,000 to just over $30,000. And I think the same thing would happen up there because they now see the writing on the wall, because that has happened not only there, but also in the Wausau Stevens Point area and other parts of the state. And they're contracting from the Marshfield Clinic with some of the networks, such as the Alliance, has reflected that change and strategy. And so what they're doing is they're trying to make their more shoppable procedures more cost effective in the local markets. Yet when it comes to kind of the more expensive things, whether it's preemie babies or stage 4 colon cancer or something, they tend to hope that they're going to get those more expensive patients, which are $250,000 or $1 million in revenue for them. So on a unit cost basis, I think this is going to be a good thing. I think the challenge for the county is to control costs on some of those potential higher cost claims, such as cancer, and use a second opinion program to reduce the utilization for some of these high cost services that are largely unnecessary. And when appropriate, that the patient is treated at the location that has the best opportunity for a good outcome, because that's where you're going to save a lot of money. And that may mean that someone goes into the complex care program at the Mayo Clinic versus being treated up there in Ashland County. And again, that's a decision that's often made, with the patient really directing their care, but they need to be comfortable with that. And that's what our advocates are there to do, is to help them understand, here's all the advantages and sometimes the disadvantages of choosing better or higher value, higher quality options in healthcare, because this is no longer hitting the easy button. It's really helping them understand how their choices are going to affect their financial condition and possibly their medical condition.
Great. Laura, did you have a question?
Are these going to be given to us so we can put them in the packet online?
Yes.
And then commentary on, the mergers seem to be a thing now.
Yeah.
Gunderson and Bellin.
Yep.
And Dean Health and SSM, and so Medica taken, it just, I think they all see the writing on the wall and that they're gonna need to shore up themselves in this kind of market.
I agree. Yeah, I think there's going to be some interesting things that come out in the next couple weeks with the Medica Dean Prevea piece. I also think, and this is a question I have out to my rep at Medica, or actually at Security Health Plan, is with the very unionized state that Minnesota is and the very non-unionized state that Wisconsin is, I'm very curious about how that's going to affect the Essentia and Security Health Plan Marshfield merger. Because right now there's going to be a second nurse strike in a year in Minnesota. They just authorized it this morning. So that's interesting to me because we have become a very non-unionized state. Minnesota is still very unionized. So that's something else I'm curious about. So yeah. Any other questions for Ross on the Alithya's piece? Okay, Ross, thank you so much for being here. We appreciate it.
Thank you, Kristen. I have one comment on the Essentia Marshfield merger.
Yep.
And I think it's important to look at northern Minnesota. So if you drove from Fargo to St. Cloud, it would be unlikely that you passed a medical group that wasn't affiliated with Sanford.
Mhm.
And there is a strategy here. And we have to recognize that the strategy is a monopoly in certain areas.
Mhm.
And the type of program that we're building and what Kristen has tried to do all around the state is to not allow a monopoly player act like a monopoly by making sure they know that the employers are willing to send their people outside of the monopoly area. And it's really just keeping the honest people honest in this category. And that's what Alithya's does. It's really supports Kristen's cost containment strategies, not just with this, but with diabetes programs or whatever else she has in place. Maybe specialty pharmacy work, infusions, things like that. And what I've seen her do in other parts of the state that's worked very well is finding a place who will do those infusions at a more cost-effective way, or getting these bundles for these common procedures. And little by little, we'll put the economic pressure for these big systems that do have a monopoly to not be using that to the highest extent that they can, which we've seen in the past. So thank you very much for the opportunity. I would love to work with you and love to get back up to the northern part of the state.
Thanks, Ross.
Thank you,
Um,
Kristen.
I do have, since this one came up.
Uh-huh.
You knew this one was gonna kick me up.
It is, and he's on, Nick is on, so he's gonna talk through this proposal at a high level, and then I do have Scout RX
All right.
joining us in about 20 minutes. One other thing I wanted to say about the Alithya's transparency piece in this market and all the mergers happening. It's also why I think it's really important that we're engaging with the local hospital, because I also see the value in keeping money here in your community and making sure our independent physicians have the ability to continue on the life that they've chosen, to stay independent, to not go into these big provider systems. So that's also vital to me. So saying that, Nick, are you on?
Yep, I'm here.
Perfect. Thank you. I've got your presentation, Nick, up. Do you have a specific slide you want to start on, or do you just want to start at the beginning?
Yeah, I mean, I have some other slides as well that we could, dive into. I know, has everyone seen the proposal that you have up? I mean, I can walk through the proposal as well, but I do have some other slides I can kind of share about Capital RX and our value prop. So
Perfect. We're going to give you the ability to share those, Nick.
okay. Great. Let's see. All right. Can everybody see my screen?
Yep.
All righty. Well, so I really appreciate, I just want to start out by saying thank you. Appreciate the time this morning. I know we're, tighter on time, so I'll make it pretty quick so that you all can ask as many questions as you need, and happy to, feel free to interject, or we can jump around as well. But real quick, just Nick Van Hook, Senior Director of Commercial Markets at Capital RX. So on the sales side, been here for, almost 4 years now. been in PBM industry for, over 10 years at a larger carrier, spent 7 years in consulting. And really what drove me back to Capital RX was, as a pharmacy consultant, really thought that a lot of the issues and things that were being asked of the pharmacy space were being answered by the folks at Capital RX. Helps that I happen to know them pretty well from a previous job, but really excited to be here to tell you what we're doing and how we're operating differently in the marketplace. So like to start out just our mission-driven company, and it really is to fundamentally change the way drugs are priced and patients are cared for, creating enduring social change. And we like to start with this because it's something that we like to keep on your mind as we walk through a presentation. For those of you, and I won't, I can send this stuff afterwards as well, so I'm not going to spend too much time on some of these slides that are high level like this. But just a quick snapshot of who we are today. Founded in 2018. I actually was the 14th employee. So really excited to see the growth we've had. We cover over 1.4 million lives today. We're well over 400 employees. So significant amount of growth, which has been really excited. A lot of metrics. A lot of the growth is due to the metrics on the right-hand side from a service and satisfaction standpoint. But most importantly, we wouldn't be able to have this level of growth or the ability for our clients to be extremely satisfied with the service we provide if we weren't actually saving them money. So again, I'll send this over and we'll get a little bit more into some of these metrics as I move along here. And then on the lower right-hand corner, you can check out our website for any of these accolades we've won. There's formal releases out there. What our book of business looks like. So as I mentioned, 1.4 million lives covered across Medicare or commercial, Medicare, Medicaid. So diverse book of business here. We really cut our teeth though in the public sector. So school districts, municipalities, counties. I think the majority of our book of business honestly is made up of public sector labor and health system. And so obviously, a lot of it driven by savings, but I think the things you see across those three more than you see necessarily in some other employers you work with is a real high level of service is expected of them and their members and their benefits. So I think it's one of the reasons why we've been able to grow so quickly in those spaces. And like I said, some of our earliest clients really in that public sector. And then on the health plan side, PBA, that's more of, a newer line of business and some of the partners we work with there. So we really live on a day-to-day basis, really three core principles, and I'll touch on each of these in a minute here, but alignment, service, and innovation. And so we start with alignment. And when we talk about alignment, you hear traditional pass-through PBMs out in the marketplace. We look at alignment as taking pass-through a full step further. PBMs and pharmacy benefits are obviously at the height of a lot of talk on the news these days with legislation and all these things happening in states. And when our founders started the organization, the key principle in alignment was drug pricing is broken today. And we like to use the Tylenol rule as the example of why and kind of the way it is today and the way it actually should be. So if any of us were to walk into a pharmacy, right, we all walk down the street, we walk into the pharmacy, go down the aisle, and we grab Tylenol off the shelf, we're all going to get to the register. We're going to pay the same price for that piece of Tylenol, for that bottle of Tylenol. It doesn't matter if we work for the largest company in the US, the smallest company. It doesn't matter if you're insured, uninsured, we all pay the same price. And we know that because unit price is actually displayed on the shelf we've taken it from, right? Basically like we purchase every other consumer item in the US. But when it comes to pharmacy benefits or even healthcare really in general, but particularly here in pharmacy benefits, everything is based on lumping these drugs into annual discounts off of a really relatively unknown number to, the most of the market. And so in that same example today, and 99% of contracts out there that utilize AWP discounts, you're seeing discounts as you go down that aisle, $18.82. And we can all grab that same bottle of Tylenol for 18% discount, but we all may pay a different price, dependent on, what the PBM's doing from the back end. And so, the goal for us was to completely eliminate, the game of AWP and get this to a more simplistic approach. And that is through a cost plus arrangement. And so scouring the pharmacy world for what's the best source price. Because one of the things we want to do is, when we talk about alignment, is remove any ability for us as the PBM to ultimately, quote unquote, manipulate or add spread to price. And so from this cost plus arrangement, we landed on national average drug acquisition cost, or NADAC. One of the reasons we like NADAC is because, one, CMS manages that price list. So it is not a Capital RX price list, and it's free. I mean, you can Google Medicaid acquisition cost right now, and you're 2 clicks away from utilizing the price list that everybody in our book of business uses. The other thing we really liked about it is that it's real life economics. So pharmacies, right, who purchase hundreds of thousands of medications throughout the year, all these pharmacies, right, they're reporting in acquisition cost. CMS creates an average and they publish that price. And that's ultimately what we're utilizing across our book of business. And so not only does it stabilize price for membership, so if your member goes to, a Costco up in Ashland County, or a CVS up here in New York, or a Walgreens in California, the drug price is actually the same. There might be a minor nuance in the dispensing fee depending on the pharmacy, and that could vary $1 to $2, but price is now largely stable. And again, not just stable across your population, but you now have access to the lowest price that we can get, and that's the same price that our health plan that's 400,000 lives that covers multiple lines of business is accessing. So everybody in our book of business is paying that same price. The other thing we really love about NADAC is that because it reflects actual economics, is that you can see drug pricing is actually deflating over time. And so up here on the screen, I have, the comparison on what AWP does compared to NADAC. And so, the majority of the US today in these AWP contracts are, contracting, or their contracts are based on that blue line. So, and if I took this off the page and said AWP inflated 1% over the last 6 years, we'd all say that doesn't sound all that bad given what inflation looks like. But at the end of the day, the PBMs and the pharmacies and everybody else in the supply chain is purchasing it at that orange line. So it's deflating. Generics are deflating yearly 10% year over year. And so, we like to point out that in today's environment, PBMs are negotiating with pharmacies and purchasing for their own mail specialty at that orange line, and then going ahead and contracting with their plan sponsors at the blue line. And so everything in between is that hidden profitability that you continue to hear about in the marketplace. And so we've eliminated that by utilizing NADAC. And we like to look at it as resetting the baseline, where we can no longer need to focus on the definitions or what drug goes under what discount. Everything has a unit price in their contract, and we can really focus on servicing you and your members and managing it more clinically appropriate and making sure members are taking, again, the most appropriate medications. As I mentioned, this is the generics bucket. What we've seen on branded specialty recently, and we're waiting for a full year of data to kind of see if it course corrects, but what was very similar, AWP and NADAC and branded specialty has now started to do the same thing, where pharmacies are actually purchasing brand and specialty medications for less than what AWP is. So you're starting to see that same detachment of a line from an inflation perspective. And so it's one of the reasons why, our clients have had such a tremendous amount of success saving money. And so I know that was a lot, but before I move on, I wanted to see if you had any questions more so in alignment and the pricing.
It's my turn. Hi, Laura, District 3. As we talk about these generics, I know I know the pricing on some is coming down, especially because some of these patents are wearing out and they want to start getting competitive. In the places where there's not, there's also biosimilars. Now between the biosimilars and the generics, how do we incentivize the one that, or at least trying out the biosimilars and generics and doing some education on them?
Yeah, no, absolutely. Great question. So, I guess there's a number of levers you can pull, right? So one of the things, obviously, We can do it from a messaging standpoint and plan design setup where there's soft edits at point of sale for retail pharmacies. There's, notifications we can send out, whether it be letter, through messaging on the app, or emails, whatever that might be, right? Whatever the best way to access, your clients, your members, whatever, kind of communication they are most acceptable to. One of the unique things we have in our mobile app, which I know in a lot of cases, still apps and member websites are very underutilized, but we also identify. So if a member goes to fill a prescription and they do have a push notification, or if they happen to go in their app, they will get a notification if they have a lower cost alternative, may not just be a generic, but just a lower cost alternative in general. So, it's a program that's automatically built in for our entire book of business, where if, as soon as a script gets filled or gets sent to the pharmacy, it will trigger, the back end of our system to look for alternatives that could be less expensive, and that will pop up. Now, obviously that requires the member to be either engaged in the app or have some sort of push notification to see that. But that's one way that we're starting to see success. But the other way is, through clinical edits, right? Prior authorization, step therapy, those types of things. And not every plan is always open and excited about that because, it's perceived quote unquote disruption. But I think if you handle it and message it to the members appropriately, I think members want to become better consumers. I think they struggle in today's market because there's just this complexity to drug costs and drug pricing and all that, as long as you kind of handhold that member, you can walk them through taking lower cost medications or identifying lower cost medications with them and their provider.
And you can't turn around without getting hit with a commercial or a magazine
What-
ad
and
or
that's-
anything about all the name brands, but
That's yes.
Is there a way to know which doctors or facilities actually get some kind of incentive for pushing a name brand?
There isn't. So we obviously will get that MPI information, like doctor provider information. We'll know who writes the prescription, but beyond that, there's no real line of sight. And I would say across the industry, that is, that's a challenge for everybody, because obviously we don't know who's in the doctor's office, who's pushing what. But to your point, we're one of 2 countries in the world that allow for the marketing of these high cost brand medications. So when people see it on TV, it's like, let's go, so
Let's go get some Skyrizi.
yeah.
Or some Trulata.
But I was trying to think of the other one that keeps coming up for me too, some diabetic medication, but yeah.
Yeah, otherwise, and I know you talked about disruption and stuff, but otherwise my question is about carve-outs.
Mhm.
I know there are certain medications that are just astronomical. And there are sometimes biosimilars or generics that are FDA approved to do the same thing.
Mhm.
Is carve-outs in your plan? Because I know everybody gets a little ruffled when I bring it up.
No, we're very
Also,
open.
I mean, we can also help people get that, if it really is that medication, we can help them, when they say, if you can't afford our medication, is there a way for us to help them get that medication through the company then? If that's where they're the most comfortable.
Yeah. So one of the things I would say from our standpoint when it comes to carve outs is we're agnostic. We do not own mail specialty. We don't profit from dispensing. It's a flat admin fee. Everything is cost plus. So I think right then and there, it allows us to be able to bring in all these different types of partnerships based on, a plan sponsor's needs. Now, one of the things that we've seen in the marketplace that obviously has been a hot topic is the patient assistance carve out programs, right? Where you're ultimately carving out specialty to leverage the patient assistance funding for these members who do qualify based on federal poverty limits and stuff like that. So we've actually built out our own program internally to be able to do that. And one of the reasons we did it is we want to make sure the member experience is the best, because then sometimes in those carve outs, it's a lot of bouncing back and forth and trying, if you're working with another organization. So with our carve out program, we can still do bridge fills. We can still leverage, the low hanging fruit copay assistance available. while we work with that member to see if they do qualify for patient assistance funding. So we do have that program available. And yep, so we have it available. Or like I said, we're, if there's one you know in mind, we're happy to let them plug and play as well.
Carve out is a big conversation right now and trying to figure out how to pull the dollars and make sure that we're still allowing the patient to be taken care of in the way that they need to, right? So it's this fine, because you say carve out and everyone's like, hold on. When I say carve out, what I mean is let's find the best price in the market to make sure that everyone's still getting and being taken care of.
Yeah.
So,
Well, and like I said, there's always that unseen and sometimes not known about piece where it's, if you see Skyrizi stuff inside your doctor's office, that medical rep has been there handing out some stuff. So that should be part of people's process as they go, okay, so
Yeah.
that thing cost me $45 a month to take. Are there alternatives for that are similar, have been shown to be effective, kind of things like that? Because sometimes we hang on the words of our doctor, especially when we've got something medically scary going on.
And the doctors just, in a lot of cases, also don't have access, right? At times. So they're somewhat, to be fair, blind from it. Yes, of course, the drug reps in there and doing their job, but they also don't have a level of insight sometimes into what a member might have to pay. They may know, but there's thousands and thousands of drugs. But I will say the other thing with stuff like, these high cost, especially in brand medications, I think because we don't profit from specialty medication, right? We have a flat admin fee, so it doesn't really matter. We're not making 20% on this medication. Our prior authorization rates are more in line with true clinical guidelines, where we're walking a member through to say, do you really need this high cost specialty medication that 1% of the population takes? Or can we take a lower cost brand medication that thousands and thousands of folks, because it's not just the cost of the medication, it's side effects, it's all these different things that I think sometimes get lost in this process. And so I think part of some of the clinical metrics we pulled beyond, the carve out stuff is that we're truly going to see if a member needs that medication. If they don't need that medication, why put them on that, right? Again, we can easily transition them to something less. And I think that's where working with the member, keeping them educated on this, and also working with the provider, once we get engaged with that prior authorization process, to make sure they're, they either, if they need it for a medical reason, we're going to allow it, obviously, right? But at the end of the day, if there's a better, lower cost medication they can take with the same clinical outcome, that's where we're going to push it.
Okay. And so even with people who are currently taking medications, you guys take that on and do some education and.
Yes, I will say during the transition process, in a lot of cases, people like to do the continuation of therapy so that it's not, we can get them on board and do that. Folks with prior authorizations already, they're used to doing this on an annual basis. So those will carry over through the rest of the life of that prior authorization. But then when they need to go back through the review process, it'll be on our criteria and we'll see if there is a better alternative for them to move to. Absolutely.
Okay. Because on those commercials, it's always nice to see the explosive diarrhea, the sight loss and such like that, and that little tiny lawyer print in white. So you really can't read it even if you've got good eyesight.
Our chief growth officer had one of our friends, a little loss of hearing for one of those specialty medications when she could have been on a brand. So like it's real. It may be little, it may be a small percentage, but it's real.
Yeah.
awesome. Other questions for Nick, you guys? Nick, could you show the savings that we would see by moving to Capital RX?
Yes. I had that document up. 1 second. Oh, there we go. Hold on. So here's the projected savings at the moment. Obviously, this doesn't account for any current rebates. So, the 30% obviously would come down a little bit depending on what those are. But ultimately, we look at it in a number of buckets. So from an ingredient cost perspective, we're talking just true drug costs. And this assumes current utilization. So this isn't even talking about what we may be able to shift to lower costs. So there's a $40,000, close to $30,000 savings on just true drug cost based on current utilization. And again, that's not even assuming we can move any of those members to lower costs. So there should be some more there. Rebates projected around 95,000. We're 100% pass through. So I think our book of business averages around 10% over performance to date. So you should hopefully expect to see more there. admin fees. And then we look at two things that we accounted for here as well, especially cost optimization. That is just your low hanging fruit copay assistance. So that's not the the alternative funding stuff. And then low value drugs. So there's we call it our dumb drug list. I guess we could figure out something more sophisticated, but it's our dumb drug list. Like a Duexis, which is a $4,000 drug, carries a massive rebate when you could ultimately go over the counter and take 2 $5 medications and get the same outcome. So we target like some of those, like Duexis, Famovo, and Carafate, or some of the bigger names you tend to hear, to eliminate that. So obviously, based on the savings here, we don't see a lot of that on your plan, which is a good thing. And ultimately, it kind of gets us to that savings of the close to 100,000, again, depending on what your rebates are today. But those are the areas we target. And again, this doesn't assume any shift in that medication.
Yeah, and we're at about $40,000 to $50,000 in rebates right now. I just
Okay.
asked for an update so we can have Nick actually update this to show that total cost savings. The other advantage to not having people using some of the Duexis and those other things is that now those are things we will carve out. Those are things we're going to exclude.
Yep.
Because when you can go buy Pepcid and Aleve at the office, at the drugstore for $15 instead of us paying $4,000 for a medication, those will be the things that we will eliminate from the plan. We will not eliminate the specialty medications. We just want to make sure we get people taken care of, but in the most cost-effective way for everyone.
Okay, the other thing, and this may not be a him thing, I don't know. When people are in the hospital or coming out of the hospital, but they're getting those medications, the $20 Tylenols or things like that, where do we have play in that?
Nick, do you have an opinion on that when there is in-hospital stays? Do you guys do different things with different plans?
I don't believe so right now. It would probably just trigger off at the network. As far as I know, it would just trigger off at that in-house pharmacy or that hospital pharmacy network rate.
Yeah. Sarah, from my team, Sarah had mentioned to me yesterday that she worked on fully insured carriers for a long time. And they actually, do you want to speak to that, Sarah, just for a minute?
Sure. Yeah. And it's typically through the emergency room. So say I go in and I bang up my knee and I need codeine, or some other antibiotic. If it's dispensed through the emergency room to take out, it's typically not covered on those fully insured plans because it's not in network pharmacies through the PBMs.
So I think there's some things we could think about from that perspective. And again, additional education is what I would say, Laura. So yeah, I appreciate that. Any other questions for Nick? Yep.
This is Pat. Is there any correlation or relationship between providers, doctors that say prescribe the higher cost drug versus lower costs?
I don't believe so, no.
I think sorry.
No, go ahead.
Sorry to jump in, Nick. I think what we're hoping is going to come out of all of this new pharmacy transparency piece that's happening. So in the self-funded world, the law was passed a couple years ago, but they're now just putting the deadlines on reporting in different pieces. So I do think there's some hope with that updated reporting. So the government has never looked at pharmacy before. And so this is the first time our government is going to have access to what to what drug companies are actually charging and what provider systems are paying and how those things are all working. So I think in the next couple of years, we're going to start to see this become a more transparent market, even than we already have. But right now there is no reporting. There's no list of, hey, these 10 doctors get paid an additional $1 million to prescribe Duexis or whatever it is. There's no access to any of that.
You can see prescribing patterns when you bring it down to a plan level, but again, there's nothing to your point, Kristen, there's nothing that we can see beyond other than like, maybe why is this doctor prescribing this medication, right? And maybe it's the same doctor prescribing that same medication to a bunch of different patients. You can make some assumptions, but beyond that, there's no real line of sight into that. So yeah, hopefully, as I mentioned earlier, the legislation that's out there, now with CAA reporting and all this stuff, this will come out. A lot of this stuff will hopefully come out over time to figure out, where there's too much where the value is being pulled out of the market.
So back to the competition bit from the earlier in the discussion, my hope would be then if there's more competition, that the healthcare system, including the doctors making the prescriptions, start saying, gee, as if I want to keep my waiting room full, you know, I need to do what I can to be competitive with, you know, other places. So maybe
as-
this competition will help doctors to prescribe alternatives too.
Go ahead, Nick.
Yeah, no, I was gonna say, as technology catches up too, I mean, you're talking about industry that is far, far behind from a technology standpoint. So as technology catches up as well, and you can get more of this information in the doctor's hands, or, you know, as I mentioned, patients can become better consumers because they get more line of sight into this drug pricing and stuff like that. They can, you know, have those more meaningful discussions with their doctor in the office, as opposed to, you know, a lot of the unknowns that they face today. And again, you know, drug rep comes in, doctor prescribes a medication, member doesn't really know it. They're just trusting their doctor. And it's sticker shock when they get to the pharmacy. So I think getting members more engaged, making them become better consumers will help at the end of the day. But, you know, that has been a struggle to get them engaged. I think they want to become better consumers, but I think, you know, again, we need to get drug pricing to a spot where it's stable, and that, you know, all of us on this being on the same plan will pay the actual same price for medication, not show up and pay a different price. So it's kind of a game of it's like a roulette wheel today. But
Yeah, I also think this is where we can tap into our independent physicians that are at your local hospital. Because to me, there is a difference in them understanding their patients and knowing their patients versus being involved in a very large provider system where there is some cost driven there. In a larger provider system, the bottom line is, hey, we need you to make more money. So those docs, in my mind, this is just how I imagine it works, is, hey, I need you to sell these things because we need to make more money, versus independent physicians who are like, hey, I get to just take care of my patients. I get to do what's right. So that would be my thought there. So awesome, Nick. Thank you.
thank you, everyone. Really appreciate it.
Yep, for sure.
All righty.
Next, bye. I did see Rich was on too. Hi, Rich.
Hello, how are you guys?
Good. I'm going to share my screen, Rich, and just pull up your presentation.
Okay. We also have Heather Mojica on the phone. She's also from Scout RX. She's our sales rep out of Michigan. She's here for training purposes, if that's okay with you guys.
Yeah, that's great. Thank you. So this is the proposal from Scout RX. So I'll be very transparent. I have 3 or 4 or 5 clients with Scout RX already. I have not, Nick is another partner of ours, but not someone that I've worked in detail with. I can speak to this program differently. I know their presentation is different than Nick was from a pricing perspective. So Rich, I think really what the group is curious about is looking at savings, but also the pricing component and how you guys are doing that from a transparent perspective, like how it works with ProAct from a pharmacy perspective, what all of those different things kind of flow through at.
So from a pricing perspective, that's not our main focus. And here's the reason why. Because pricing components take into account the total cost of the drug. Scout RX's goal and sole purpose is to lower the cost to the plan without affecting the member's benefits. What a total cost of the drug is doesn't matter to us. What matters to Scout is what the plan cost is. So if the total cost of the drug is $100, and for another PBM it's $95, that doesn't mean it's cheaper for you, the plan. And that's where our programs come into place to make sure that it's cheaper for you, the plan, regardless of the total cost of the drug. Is our pricing competitive? Yes, it's competitive. Is it better than anyone else's? Is it going to beat a CVS or Optum? No, absolutely not. Not when it comes to the total price of the drug. Where we win and where we excel is lowering the price to the plan. And that's because of our programs.
And the plan and the member. So that's the other vital thing. So we're not just reducing the cost to you guys overall on a health plan. We're also reducing what the employees are paying. So for the first time, you guys, in the last 12 months, we've had someone on the plan who's got a specialty drug. Previous to the last 12 months, we had no specialty medication, like nothing crazy. So Meaning we now have one that costs about $10,000 to $12,000 a month. That had not happened prior to this past year. So that's why we dug in even more this year to kind of look at this. So when we work with Scout, what we see differently with our clients is the reduction on the employer and the employee side. So oftentimes we build the plan out to have the employee pay zero or less of a copay because it drives them to use these programs that Scout offers, which is specialty carve out, copay optimization, and international mail order. Go ahead.
Do you have a presentation?
I'm sorry, in my mind, I'm sharing it, Laura. So yes, I
It's
do.
okay,
I
have
apologize.
those days.
I was like, oh, I
Do you
thought
want
I
me to
had-
share my screen, Kristen? Because I just have a few slides up that I'm just gonna focus on because of the 20 minutes. I
Yeah.
want to make sure I get,
Yep,
that way
that would
they-
be,
okay, let
Great.
me share. Host a
hold on,
stable
Rich, we're gonna
particip-
get you permission.
Okay,
Thank you.
Yeah.
I literally was looking at it on my screen, so I'm sorry. I thought
I
it was
looked
up.
over and I thought that might be, but
Yeah.
as long as those slides, I don't know if you were on while I had questions for the previous person, but I just hope those questions will get addressed.
I don't know that he was, Laura. We kind of timed it. So you may need to re-ask your questions, but go ahead,
sure.
Rich.
Let me work through the four programs we have. And then I'll just stop at that point. It will take me about maybe 5-10 minutes and you can ask as many questions as you want. So our first program is really the mainstay of Scout RX is a specialty program. So what we do administratively is make specialty drugs non-formulary. What that does for us, it gives us the opportunity to get the drug for free from the manufacturer for both you, the plan. Remember, that's the focus of Scout RX, the main focus, to make sure the plan cost is lower and keep the member happy. For you, the plan, and the member as well. So how it works is before you come on board, a month before you come on board, we get the names of the folks that are currently on these medicines. We call them up. They have one patient advocate, one person. We talk to them, tell them there's a new process involved. And we take care of all the paperwork. We work with the doctor, the manufacturer, and obviously the member. The member simply has to sign the form that we send into the manufacturer and provide their income. And so what Scout RX does is they take care of this application. And we say to the group, the manufacturer, hey, this member is living by themselves. They don't make any more than $60,000 a year. They can't afford the medicine. Will you provide it? And again, on the right-hand side, you'll see the barriers in terms of the income barriers. And most of the time, the member will qualify. If they don't qualify, we still cover the drug and we use different programs. But the specialty program is the mainstay. There's no disruption because if for whatever reason, it takes more than a few weeks to get them qualified, we'll make sure that we get that drug for them through a different means and we'll still lower your plan cost. It's just not going to be zero. This is the biggest savings that you'll have in your group, especially a county group. There's usually quite a few specialty drugs. So I'll leave it at there. If you have a question, I'll show you the result of how it works. So on the left, the gross pay, and this is where I say total cost to us and discounts don't matter as much to us because this is what the effect of our program has. Gross pay is $6,000. The member copay is on $100. Your plan pay, and this is a typical drug called Humira, would be $5,900. Well, in the Scout program, the gross pay is $6,000. It might be $6,100. It might be $5,800. So if it's $5,800, companies will say, well, I'll save you $200. Well, you didn't save you $200 because the plan pay is still basically the same. So in this particular scenario with our program is the member copay is $0. They don't pay anything. Your plan pay is $0. So the manufacturer is the one that picks up the entire cost. The reason why manufacturers do this program is because they don't want to be in the news for someone not being able to afford their medicine. So they offer these programs. Scout RX takes advantage of them to help the plan lower their costs. Any questions on this program?
Yeah.
Sure.
So does this mean you didn't actually take a look at what our costs are and try to do something similar, or are these just generic?
This is
um,
generic. This is just an example of the drug Humira.
Okay, so you didn't look at our data.
No, he did look at
I
our
did.
data. That was the original proposal that I showed first last month, was your actual data.
Well, what I remember is you guys had a very cute dog that was on all of this. I'm loving the scout thing with it. But I didn't see a lot of data. I saw a lot of pictures and wanted a little more digging down in for what those were, for like actual relatable, straight across kind of, hey, this is where we're looking at just as an overview. And here's, I know you have, you pulled out Humira and stuff like that, but I was just looking for a little more detail than some.
think that's the
generic average stuff.
Okay. Kristen, we'll bring up the proposal after I get through the 3 programs,
Okay,
and then I'll go into more detail there. Is that okay with everyone?
Sounds good.
Okay. Copay optimization program. This is a different program. I don't know of any other PBM that does this. So what happens here is we take care of the high cost non-specialty drugs as well. So this program really affects the diabetic drugs that are in the $800 to $1,500 range a month. So they have most of these drugs have a copay card. And it is exactly what it means, a copay card. It's for the member copay. It's to help lower the copay for the member. The group doesn't benefit at all. So what we do, let's say your copay is $50. You say, okay, member, I want your copay to be $50. The copay coupon card might be worth $200. So in a typical scenario, the member will use that card and it might go down to $10 and they only pay $10. Well, that wasn't your intent as a plan. You wanted them to pay $50. So what we do is we go in the system and put that copay, override the copay at $250. ScoutRx gets the copay card for their member, sends it into the pharmacy with instructions, and the member will pay $50. But by doing this, we have now saved you, the plan, $200. And we do that for any high cost brand name drug. Does that make sense? Most PBMs use this for their specialty program. So let me show you what it looks like in savings, how it looks like. So Latuda has a $400 copay card program. Gross pay is $1,200 in a regular PBM, $50 for member copay, plan pay is $1,150. With the Scout program, say the gross copay is $1,200. The member copay is we override it in the system to $450. The plan pay now drops to $750 and the manufacturer picks up $400 and the member pays $50. So we do this for all high cost brand name drugs. Does this make sense? Any questions on this program? Okay. International program. International works intertwined with the copay card program, because what we do, we have a calculation method where if the drug is cheaper internationally, the plan pay is cheaper internationally than locally, domestically, USA, then we'll send that medicine to international. Again, the member doesn't have to do anything. We're the ones that call the physician. We let the member know that what we're doing. It's a volunteer program, so they can say no, but very rarely do they do that because it's $0 to them. So that same instance where that Latuda, if the plan would pay less in Canada, that means that member would get it for free and not pay $50 at all. And by doing that, we save you money. And now the member also saves money. So I'll give you, that's pretty straightforward. It's a 90-day supply. It takes 5 to 7 business days to get to them. It includes refrigerated items. They have a special cooler for that takes the temperature out throughout the delivery process. So this program works very well.
yeah. So Laura, I know you wanted to see the savings. So they do, Rich, I'm going to pull up your presentation.
Yep, let me do one more.
Okay,
So let's go the medical specialty solutions. My understanding that you're looking at Prairie States.
nope, we're with BPA.
Okay,
Yep.
Okay, sounds good. Okay, perfect. Okay, go ahead, bring up the,
Perfect.
I gotta stop sharing my screen.
Yep. So Laura, they do present numbers very differently than Capital RX. And what you're traditionally used to seeing is Capital RX, which I totally get. I know that Rich has those numbers on the back end. It's just not presented to us that way. So what I would say is, I don't think that no one's afraid to share those numbers. It's just not something we generally present to a group, right? We don't normally have people that know those numbers as well as you do. I'm going to be totally honest. Like, that's just the reality of it, right? And that's not a bad thing. So what I would say is, the overall savings that Scout RX is showing for you guys versus Capital RX, right, was at about the 30%. Scout does something very similar from a pricing perspective, is they always underestimate what they think the savings will actually be. So from a savings perspective, right, we really do think that there is a larger savings here. It says 30%. This is your actual data. So numbers wise, we do think that there's a little bit more projected savings that could happen with this program versus Capital RX. So what I would like to do, Laura, is can I get the detail stuff that you want from Rich and send it to you?
That would be cool.
Okay, Rich, could we do that for Laura?
I'm not sure what the details she wants.
I'll share with you. I know exactly what she's asking for, so I'll share that offline with you. But
Okay.
it's just a different reporting. So I do get it. So I think ultimately, you guys, what Rich is talking about with their program is it saves the plan and the member. Capital RX is really, it is saving the plan money. It's not necessarily saving the members in the same way. So that doesn't mean it's bad. It's still all there, right? And I guess you guys just need to decide which you're comfortable with. Go ahead.
No, I wouldn't be doing my due diligence
No,
if I didn't
go.
ask, because you seem to like the Scout RX one better.
I just know it.
I'm
I'll
gonna
be
go,
honest.
are you guys getting kickback?
No, we're not at all.
Yeah, I
It's
just wanted to clarify
Yeah,
that.
we are not getting kickback. It's truly what I know, Laura. So that's why I can speak to it differently. That is purely what is happening here. We do not get any kickbacks. You guys are on a consulting agreement. What I get paid is exactly that
To find the
consulting
stuff.
agreement. I
Yeah.
do not get any more from this, nor does my company.
Yeah. Well, I know you
Yep.
know more about this one, so when you're asking those questions,
Yep.
like I said, I just wanted to clarify.
Yeah, no, I appreciate that because it feels that way, right? Sometimes yeah. Anyways, I could go on about this forever. So I will work with Rich to get those detailed numbers for you though, Laura. I think ultimately, you guys, we need to give our current pharmacy benefit. Oh, sorry, go ahead.
When it saves the plan money, it will then also save the employees money because the more we lower our healthcare, they're paying 10%, but it's going to lower the total that we have. Can we go back to, I think it was your first screen, maybe with the income levels on it? And then I want to compare it to the numbers on this one.
Yeah, that is, Rich, could you pull up that slide again? I'll stop sharing. Your
It-
first slide that had income levels on it.
Yep.
And my question is, you've got those income levels there, and in Ashland County, I believe we're the second lowest income in the state. And then you don't know necessarily what household income is for employees.
Correct.
So when you made those projections on the screen with the 27.88%, how did you come up with those numbers if you don't know the income levels? And because the income levels are on the low end in this county, is it possible that we're going to save more than those numbers?
Not likely, because specialty, we go by our book of business, but we also have a couple of different municipalities. Dunn County's one, City of Menominee is coming on board, but we're pretty confident in our numbers because of our book of business and what we know in terms of average salaries and how it works. So those numbers on the side, those aren't set by us, those are set by the manufacturer.
But
So
do they use county by county data on the screen with the 27.88? Because, Dunn
No.
County is a different county, certainly, with incomes there. So down there, my guess would be that there are more employees that have a spouse with a better paying job than employees here who have a spouse that are working. And so my guess would be that when you showed us the potential savings, that 27.88, my guess would be that because of our lower incomes with
That we might-
households with 2 wage earners, that we might actually do a bit better than that.
Yeah, which that could very well be true.
It's possible.
Yeah, it's possible.
Mm.
That's, yeah. So we do need to do a 60-day notice to not get penalized from our current PBM. We can make this change on 2/1, 3/1, 4, whatever that looks like, right? We don't have to wait until January 1st of next year. I do think it will bring immediate savings if we were to make that change sooner than January 1st. So what I need you guys to do is really just decide what 2/1, I'm not gonna lie, is gonna be really tight. I think 3/1 is our most, to get the communications correct, to get employees what they need, all of those pieces. But that's really the decision that has to be made from that perspective. Alethea's coming on board for January 1st that is super easy and not a problem at all. So it's really just the pharmacy that we have to do 60-day notice with. So you guys make a decision. Any other questions? I'm looking at you.
I know you are. Don't get me wrong. I love the idea of giving our employees more spending capacity, because when we save them money, it's almost like we're paying them more.
Yeah.
You know, it gives them more room in their lives. So I just.
Yeah.
And this, your program works this way with biosimilars, generics and everything. I mean, you take a full 360 picture at their, and sit down and talk with them, their doctors, everything. So it's like a whole care team. It sounds like, basically.
What we do, it's based on cost.
Yeah.
So we're not focusing on the lower cost items. What we're doing is focusing on the higher cost items. So for example, we have a $300 threshold for generics and $1,000 threshold for brands at a 30-day. And if it exceeds that, we're taking a second look. So if we're taking a second look, that means we're trying to find something that may be less expensive, but it's based on the cost. And because again, the cost change, the plan cost is what I should say. I got to keep that in mind. It's your cost that we're concerned about and the members. The total cost doesn't matter to us as much, nearly as much. And I'll give you an example what. So after I get done explaining this, so we take a second look. We also, after the first fill, so we don't have your data. We have your data, but we don't know exactly how it's going to transfer to April 1 or March 1 or whatever you do. So the member fills one fill and it's a high cost brand name drug. We have it in our system now. We act according to that fill. We'll put it in our algorithm and it will show us whether it's cheaper in Canada or cheaper with our copay card program here. Specialty drug is different. That works differently. But in terms of the daily drugs, if we see a generic drug that's over 300, we're taking a look at it because there are a lot of things we can do to lower that cost. We have a program with a mail order company that does it. We can sometimes go to Canada with it. And then sometimes what we do is we use GoodRx and we pay for it out of pocket and just put that on your bill, on your monthly bill. So there are sometimes where going through Proact is our back end, our processor. Sometimes we go through them and there'll be a drug they're charging $4,000 for. But I look at GoodRx and it could be $300 or $400. So what we'll do is we'll call that pharmacy up and we'll say, run it through as cash. We'll pay for it. ScoutRx, we use credit card. And then instead of going through our processor behind the scenes, what we'll do is we'll just charge it on the group on that monthly statement. So we save you $3,600. It doesn't happen very often, but it does happen. For example, the total cost, here's a reason why I keep saying total cost isn't a huge factor for us, because here's why. Ventolin inhaler here in the USA is about $55. If your copay is $50, okay, the member pays $50, the plan pay is $5, okay? The same inhaler in Canada is $22. So another PBM will say, well, I saved you over $30 on this drug. It's not true. If I send that inhaler to Canada, the member pays 0 and you, the plan now pays 22. I actually cost you, the plan, $17. And that's what I mean, that when we go by total cost, it's not correct. We have to go by plan cost, because that's your bill at the end of the day. It's your invoice and what you pay, and that's what we focus on. And that's an example of why total cost is kind of it's just not something that we should be focused on. We should be focused on your cost.
So that's basically the difference. Do you have another question?
Well, just in terms of
Sorry.
both you and the administrator,
Yeah.
what are you looking for as far as going forward? Because it seems like making a decision is something we need to do.
And yeah, Dan,
Well, we're looking for a recommendation because ultimately it's executive committee that makes this decision. But we still want a recommendation from finance because honestly, you guys know the budget better than, and this issue better.
Honestly, I still want those numbers, but
Yep.
I do think I can make a decision at this time,
Blake?
just because I'm a data geek, all right?
I get it. I appreciate it.
I just wanted to make sure I'm understanding. So we have one medication through all county employees that are a specialty medication today. Was that
Like,
right?
it came on the plan late last year. I know for sure there's that one. There may have been a second one that jumped on towards the end of the plan year. And then those are the specialty drugs. The other things that we can save dollars on from a member and a plan perspective are diabetic medications. And that is something that is very high here. So that is another place where we can save a considerable amount of money.
Yeah, Blake, there's a couple drugs that are out there, that, and I can get you personally the list of the drugs without the names attached to it. But one of them costs about 12,000 a month. Then we have another one that costs about 5,000 or 6,000.
That's correct. You have two specialty drugs. You've got
Right.
Dupixent and Humira. That is correct.
Okay, and I'm trying to avoid names of drugs, so we can't connect them to people. So yeah, and those are monthly fees. So we're paying roughly $150,000 a year just for 2 people.
That's correct.
Yeah. So,
Well, oh, go ahead. I was gonna
Nope.
say,
you go ahead,
Laura,
Blake.
are we expected to make a motion and recommendation then in this finance committee meeting, Danny?
We're requesting that, but obviously don't have to do it if you don't want to.
Would you guys like me to drop off?
Yeah, that'd be great. Thanks, Rich.
Okay. I feel like, do you have any other questions for my presentation before I drop off?
Thank you.
Thanks.
All right.
Rich.
Thank you so much for allowing us the opportunity. Appreciate it.
Yeah, so we're looking for a recommendation, but the committee does not have to make one. It doesn't want to. I mean, that's up to you guys. And we can also then postpone this item on the exec agenda too, if you want more time to consider it. Because we can pick up at some time any year.
Are we prepared? I don't believe so.
I was just gonna say, I know I'm the pain in the butt with this, but I actually am ready to recommend one of them. When it comes down to it, I not only want to save the plan money, but I also want to save the people money. And I get the difference between, I mean, I didn't even fluff Rich with my questions and stuff,
Right.
and he addressed them all. And then when he pulled out, the couple of drug names, I know they've looked at this. It's just the presentation that they handed us, just like I said, it's, it was a little lacking for me. But otherwise, I do think I'd rather see us have the dual approach with saving the plan money and saving our people money. And that seems to be a little bit more put together with Scout RX.
Blake, what do you think?
I mean, Laura's got a better insight ultimately to this. I don't, the savings are significant enough that I think we need to make a decision today. Because either way we go, it looks like it's gonna be a benefit, because these costs have really gotten out of hand for our county employees. So I think I would second Laura's recommendation with, Scout RX. At first I was a little apprehensive, but ultimately when it came back that they could do a good job with keeping the plan and employee costs down, I think that's a benefit. So I would second Laura's recommendation.
Yeah, can I just say one other piece that I know of is Capital RX, again, good, transparent, all those pieces. They don't have the same hand holding that Scout does
Yeah.
either. Like they really have a team of people that they will have a direct number to someone that they get to have the same conversation with every single month if they need to. So that's different.
Yeah.
And they're trained pharmacists too that take the calls.
And it just felt like it was a more personalized service, somebody that can explain any questions that they had. And the thing is, both companies off the top estimates were just about the same.
Mhm.
So besides that, having better service for our employees, a little bit, but probably better education since they'll have one person to talk to. And then the whole discussion circle of how they're gonna do this and the best way for everybody, and maybe getting them the best deal too. That's what puts me over the top.
Mhm.
And I would agree with Scout RX. Saving the plan money ultimately saves the employees money too. It's, so they both matter. And I think the individual attention on the higher cost drugs is important because whether we have one today or however many in the future, it helps us to deal with the potentially higher cost items than otherwise. And if we're going to try to get more competition on our healthcare plan in general, this would seem to support more competition on the higher cost. And I do think, based on his answer on income levels, if somebody's comparing us to other counties in the state, Dunn County, whatever, this is different. I think the savings here would be higher because our incomes are a fair bit lower than some of the counties that he mentioned. And so I think we'd have more employees that would qualify than what they're estimating.
Yeah.
Because he didn't say, oh, we looked at Ashland's, median income, household income.
Yeah.
Comparing us to the counties he mentioned is.
Yeah, and I think he's just speaking of counties in Wisconsin. That was actual numbers from the drug company. So I think that's where they base all of those on. And that was what he was using that for. But yeah, I agree. We've had a really, really good run and a lot of savings with a lot of groups. And that's not to say there aren't bumps, but we've been able to work through them and really still bring the savings to everybody, the member and the employer. So.
And the county can change providers in the future if they want to.
Yep,
so it's-
absolutely.
yeah.
Yep. If this didn't work, we could change on January 1st if we wanted to.
Okay, I was gonna say,
Yeah.
is this a 1 year, 3 year?
No.
Okay.
Yeah.
It's apparent we have a consensus. And is this necessary to make this a motion? Or is a consensus okay to take it to the executive committee for next week?
I think I would prefer a vote just so the executive committee knows that the finance committee actually did make a recommendation.
Can you make them?
Okay. I'll make the motion that we go with Scout RX for our pharmacy benefits.
Blake?
I'm sorry, I made a second earlier, but yes, I second that.
All right. Motion made and second to go with this recommendation. All those in favor signify by saying aye.
Aye.
Opposed, motion carried. So this will go forward to the executive committee next week. Thank you.
And I would hope if there's any kind of pushback from executive, since there's 2 of yous in here from executive committee, that you'd let us know, because really, I dig into this stuff, so. And yeah, I'd still like the numbers from them from Scout RX, just like I said, because I like to see those a little more directly.
Well, just to add on to what Laura said, is this has been a lot of thought and a lot of work for M3. So as the executive committee you know, this isn't something we came to easily. We've talked about this a lot.
Right.
Right.
Yeah.
So Kristen, will you just email me everything that was presented
Yep.
today and we'll put it up on the website for this meeting?
Yep. And then I
And we'll
will
stick
get,
it on the exec meeting too.
yep. And then I will get you those numbers. That might take me another day or two because I need to just talk through it with Rich, but I know he has them. So, thanks you guys. I appreciate being here and, I'll see you soon.
All right, very good, dear. Mhm. Moving on, item number 6, the economic development goals.
Okay, this was an item that Supervisor Kinney asked me to put on the agenda. I believe he's looking at what kind of goals do we want to see for AADC and for economic development in general, and for the Chamber of Commerce too, I'd imagine. So, Mr. Kinney?
The finance committee, you know, we're finance and economic development. We really haven't stuck our toe in the water very much on economic development. We haven't, I believe, given direction to the ADC. We get some reports. And with the ADC, something we should keep in mind is, you know, they're a nonprofit. And for them to maintain that status, they need to engage in activities related to economic development, because for their nonprofit application, that's what they say they do. Whether we need to support them or not, another matter. Just because they exist and they say that, you know, they're there to support economic development doesn't mean that we need to go down the path with them. But if we choose to, we should certainly give them more direction than what we do. They tend to focus on certain things, and it's, you know, in my familiarity with them over the last decade, it tends to be, you know, much the same thing, which is largely helping small businesses get started or individuals that have questions about getting started. But that leaves a lot that isn't where they focus. And I think that we should do more on trying to provide some direction. So there's that piece of that. And whether we want to continue in the direction of the ADC versus, you know, having someone or staff for the county is another consideration, and or with the city. You know, so if, you know, if we want to have an office for a person, you know, full-time professional that pursues these sort of things, that may be part of the discussion based on what we're looking for in terms of skill set and background to deal with that. So one of the things on economic development, I think in very broad strokes across the state and the country, is just simply housing. Without adequate housing, it's hard to attract people and keep people, you know, whether they're employees for a business or people that are retiring in a location. So the housing piece we seem to be, you know, not actively pursuing. But then there's also grant opportunities for things that perhaps the county could pursue that for whatever reason the ADC, you know, is not pursuing. So, you know, and they've got a building they maintain, and, you know, roughly half their time is just dealing with the tenants in that building and issues related to that. And so, you know, what we do is we give them money and then we're pretty much hands off. We don't work with Northwest Regional Planning very much. We do have 2 county board reps on Northwest Regional Planning, and it strikes me that when appointments are made, it would make some sense to have at least one of the people appointed to Northwest Regional Planning also be a finance committee member, so that we better understand their services. If you go to the Northwest Regional Planning website, they've got a lot of information there. But, you know, I've looked at that in the past. I looked at it again the other day, but I don't know from looking at that how much those services and staff that they have is related to their initiative on what they drive for economic development, as opposed to supporting economic development that the counties they serve are engaged in. In other words, who's the lead here? Is it, you know, counties and municipalities saying, hey, we want to work on, you know, issue X, such as housing, or, you know, attracting and, you know, businesses or expanding businesses, those sort of things? Or is it, you know, is it them leading, or is it others leading? So
I think is it open for discussion? Can I bring in a couple comments?
Yeah,
Sure.
So I have 3 bullet points. The first one was housing, which we just talked about. The second one was working on some development on the lake frontage. So apparently my son came in here right now, but working on having a little bit less industry type restrictions, or I don't know if that's City of Ashland, but then the third was, I'm a part of a group that's on the Ashland Area Aquatics. And so ultimately that group is starting from scratch, and something Mr. Kinney is talking about is where is the coordination? How is the county coordinated with the city? Are they coordinated with, AE, it just, there's very little coordination right now. So we're in this. And so I really want us to focus on, if we're giving money, that our goals are aligned with those entities like he talked about, and that there's some transparency on, who should we have somebody within the county looking for grants for some of this stuff? Because for over the last couple of years, I found out that there was a lot of federal and state money available that we just weren't quite ready to plan for. And we didn't get it. And now it's kind of like, oh, we got to get ready. So I'm really those are my 3: housing, trying to get some interest in looking at our lakefront around Ashland, and then an aquatic center, with which I was talking to a few people, and it sounds like the Bad River Tribe has a significant amount of money that they're going to hopefully build something, which we don't really have transparency in. So again, these are the things I think we should maybe flush out a little bit and have some plans for 2023 on how can we make some of these things happen.
Northwest Regional Planning has been the one that's been helping us with any kind of housing things. As for the participation of the people that are on there from our board, I've heard probably 3 updates from the people from there. When we, as a general board, we don't actually get down to the bottom of that agenda where it says supervisor reports and actually talk about things. We're all sitting on committees and we don't update each other. So it's a whole county board kind of communication issue. I see AADC as more of the business piece and business development and support kind of thing. So what we've done is we've split it off into different pieces. Do we need somebody from the county? I don't know. The lakefront, I've talked with the city on a couple of things where I do not feel they've had a very good plan for some of this, but I don't see that we have any representation or any kind of communication team or coordination with the city on this. Because as things go along, a big part of our housing issue is the fact that everybody's jacked up all the prices on it. And how do we go along and try to make it more affordable for people? We can build all the housing we want, but if we're going to do this where we're going to try to stay competitive with the other housing with pricing and things, we're going to price people out too. If we're going to make low income housing, it's totally different. So it depends on what our focus is for those kind of things. We also have parts where we've got different committees putting money in for recreation and things like that. So if we're having other committees do those pieces, that's where I always get confused about this, because like that money from forestry that comes from whatever gets doled out to the chamber through them for some reason, instead of coming through finance and economic development. So some of this is just, we have an organization issue where our committees have cross purposes. There's no communication with the full county board. So as we go through this, it may be time to straighten out some of our committees also. We've already figured out that a lot of times we have problems between finance and the executive committee. So if we're going to straighten this out, it's probably a good thing along while we're doing this to try to straighten those things out. Let's start straightening out the committees too.
The chamber gets the money because from forestry, because forestry includes the recreation piece. So it comes out of their budget because, you know, we could have more parks and we could do more to develop them as far as tourism. And there's some direction with that. And Supervisor Murdoch is on the forestry committee. There was an article in the municipality magazine somewhere around 14 or 15, and the cover story there was that for economic development, the key thing was to create a quality of life that attracted people and kept people. And for different communities, that means different things. In Ashland, clearly Lake Superior is part of our quality of life. And there's other things. When we talk about economic development, it's one thing to focus on the business owners, especially the small business owners, to help them, you know, survive and get started. But that's just one piece of it. And the first piece really seems that this has to be a place that people want to live. So do we want more young people to stay here? And the answer, you know, is generally yes. Do we want more retirees to stay here? Yes. Do we want more tourists? You know, for the most part, the answer is yes, as long as we can manage that with, you know, our housing. So if we give money to an organization and they say, well, our mission is economic development, and they see that as well, helping businesses, in particular the small businesses, and I think the larger ones, they've got the staff and the resources to make their own decisions as far as growing, you know, and how they manage those decisions. And so I think the current model is it's just trying to help some smaller people, but we don't step back and say, what's going to make this a place that people want to live and work and stay after high school? And, you know, we could all, you know, throw some things into that hat. And I think we should have those discussions. I think we should get some community input. And in particular, I think we need to do more with outside of the city of Ashland. I think we need to look at Down County because, you know, one is half the residents live outside of the city of Ashland, but the other thing in the long term, if you look at trends with farming and land, there are fewer people in the rural areas. You look at Mellon, Glidden, Butternut, and there's fewer businesses there that have those basic services, you know, gas, I mean, literally, you know, gas stations and can I get some groceries and those sort of things. There's less of that than there used to be. And part of what's happening is land is being held by people who don't live here, which on the one hand, you know, certainly their legal right, but it means they're not in our economy spending money. Yes, they pay their property taxes, but they're not there supporting that local store in these smaller communities. You know, they're not part of that community. And the less people that we have in these rural areas, the less community that there is. And when you look at why young people leave, it turns out internet access is a really important issue for the younger people, you know, so, you know, they can connect and socialize, but there's got to be things to do. There's got to be other people there. And so, you know, dairy cattle in this region, you know, kind of starting in the 80s into the 90s, there's fewer cattle. And so you look at the small communities that we have, there isn't that vibrancy that there used to be. So to me, a big part of the question is what can we do to bring some vibrancy back to those places, you know, preferably with some decent wages and income, and enable people to hang on to the land that they have. Because there are some places where a lot of that land not only is, you know, owned by people outside the area, but even our farmland in this region, more and more of it is being aggregated to a smaller number of owners, which means there are fewer households in the rural areas there. And it also means that there's more people working for service sector wages and often no benefits than there otherwise would be if we had ways of keeping people on that land with some decent incomes. And part of this might be just supporting more ability to telecommute and, you know, to work remotely. The county passed that policy, and I think that's an important reason because it gives people more opportunity to live in some of these, you know, other places in the city and have decent wages, but also then support those local economies in other places.
Didn't we most recently talk about redoing our county plan and getting that rolling? Because I think this is a good discussion for
Yes.
putting that in there and what involvement we should have with that. Are we contracted that out?
We have not contracted it out. We'll do that next year. And I'll be talking to Extension about helping with that.
Okay.
Well, to address one of Supervisor Kinney's issues, the USDA recognizes that rural areas in general are being neglected and that economic opportunities are just not there. And they're shrinking. So to address that, they created something called the Rural Partners Network. And they chose a bunch of satellite trial areas in the country. In Wisconsin, they chose a few places, and Ashland County is one of them. So we turned in a joint application with Iron County and Price County. And Northwest Regional Planning is taking the lead on all this. AADC was involved in it, and they're continuing to be involved in it. And what's going to happen is USDA is actively hiring somebody now, a person, federal employee, whose job it will be to help these communities, counties in this case, but communities with economic development, be that finding grants from the federal government, low interest loans from the federal government for businesses, for people. I mean, there's rural development loans out there to buy homes. So they'll be actively in the community working with our towns, our villages, our cities, our businesses to try to help them grow, try to help the regions grow. You know, USDA has been working in Glidden for past 9 months or so, trying to help them set up a TIF district to help them to figure out how do we grow our tourism, because, you know, snowmobiles are a big issue down there, and so are four-wheelers and ATVs, hunting. They're trying to draw more people in for tourism and to grow their economy. So some of these issues are being addressed, maybe not fast enough for what we'd like to see. You know, I know as far as the city of Ashland goes, I mean, I do speak to the mayor frequently about these issues and the city administrator about these issues. You know, I believe they broke ground on a new affordable housing complex, which is out behind the Quick Trip next to Walmart. So that's going to be a 50-unit complex. You know, there was conversation with Bad River about building one on land that they own within the city. I think that's on hold right now, but the conversations are happening. I know that the tech colleges were just recently given a huge grant to do affordable housing, and regional planning is working with them to try to help get that in here, but also Bayfield County and Sawyer County. The problem with these affordable housing complexes is not that they're not great for the community, because they are, and even 50 units, while it's not a lot, it's still enough space for 50 families. But there's a lot of local issues with it. People don't like these complexes in their neighborhoods. They think it brings in all the undesirables. Well, the reality is it's just giving housing to people who already live here and opening up additional housing. So a lot of these issues are being addressed, and you know, and I'll continue working with the locally elected leaders and administrators on how to do these things and what we can do to improve everybody's life, because it's part of we want. And I agree with Supervisor Kinney. We need to get more investment down in the southern part of our county. Those people, you know, they're hurting down there, and we need to help them business thrive there. I see Vice Chair Mertig wants to speak.
Yeah, I just want to say a few things that, and this isn't so much today, it's long term, but, and I don't want to pick on the ADC, but we need to, all of the money that we put out into the community for different organizations, we really need to see their budgets, because most of the money that goes into ADC is for staff. And I understand that. That's how all those organizations work. But it would be nice to see a budget once from these organizations, because as our budgets get tighter in the future, we're going to have to look at where we're spending our money, where we get our biggest bang. One of the things that I think some places like ADC should be doing, instead of just focusing on bringing a business to town, they need to figure out how to get internet and cell coverage. I'm sorry, But they had just put a cell tower a half mile from my house, which hopefully will be the carrier I have, because I can't make a cell call from within my house. I have to go out in the field next door. Those are the things that bring people to the area, cell coverage and internet. Because a lot of people who work from home would love to come to Ashland County and are coming little by little. But they need, in our rural areas, we need to make sure we have cell coverage and internet service, because without those, we're never going to keep anybody. Our young people today live with this. I mean, and so I think we need to say, okay, where are we spending our money and what are you doing for us as a whole? And obviously we want businesses, but we also need some of these other things, because even a business isn't coming if they don't have internet. So, and like I say, our community relies on, we used to have dairy farms, those are gone. So now it's really tourism. In order for myself to go to a grocery store, I travel 12 miles. But think of the person north of me in Glidden. They go 22 miles to a grocery store. That's a real problem. I mean, they're spending their money going to the grocery store and gas, which, you know, that's the problem we have in Ashland County. We're so far from anything on the southern end that, you know, like you say, you can go to this one or you can go out here, and somebody in Glidden is going 22 miles to get the groceries. So, you know, when we talk businesses, maybe a business in Glidden would be something that provided some of that type of service, but that's where the push should come. So thank you.
Yeah, and to that point, and both of you are making the same point, in order to attract and keep people, and this includes tourists also, is there's quality of life issues. You know, people don't always think of that as an investment in the community, but improving the quality of life is what's going to get young people here. They need to have things to do, places to go, reasons to live here. People want reasons to visit here other than the lake, or other than the snowmobile trails, or deer hunting, or whatever it be. You know, there needs to be other things for quality of life, and those are the issues. Those are the things that can keep people to stay here. So,
I've been working on that internet issue since I got on the county board. We have a federal problem. There's, you know, tell me how CenturyTel is. Expensive and not responsive. Same thing with Charter Spectrum. Norvado has been trying, I have talked with them at Norvado. They'd love to do a whole bunch of projects. Before COVID, actually just before COVID, I was down in Madison and I presented with Mark A. to WEDC. And we have gotten some money up here from WEDC to do different broadband issues. It's that federal problem we have. So those are the things we have to lean on the state for, to push on the federal, so that way we can open it up, because it's some kind of grandfathered thing, basically. And if they don't give up that territory, you know how it is, they're not going to update it, because they can spend more money down in the big cities and make more money down there. But we're trying on that. But as for us trying to tell AADC they have to do that, it's not a small spot issue for that. It's all of our people in the county leaning on the state and federal to help us get that money. It is a huge issue. You know, you guys know I'm with doing the aging unit right now. I have the hardest problems, and some of my highest costs is right with CenturyTel. You know, I'm paying $100 a month for phones for sometimes 6 calls. 6 less than, you know, like 1-minute calls. So it's an issue. And as for internet, yeah, they don't, them and Butternut do not get an internet signal. Even with a hotspot and a booster on it, you have a hard time getting anything in and out. But that's a regional thing. And I think Northwest Regional Planning was one that was helping us work on that stuff too. But like I said, Mark AA and I went right to WEDC and did some proposing and some alternatives, because we pulled from all over the country to give them ways of helping us. I don't know what we're looking at if we're not gonna have the overall comprehensive person, and we've already talked about how wonderful our budget is, unless we're going to everybody in the county again and asking for more money. Pulling in somebody with economic development weight is gonna be pricey. You know, right now, we put a lot of that on our administrator. For all the different spots that we can't afford to, I mean, he's HR, I mean, he's got like a closet of hats. How do we fix this? I don't know how we get internet here yet. I've been trying. We can put it into our plan and then talk to companies and talk to the federal government and go from there. But we already know how responsive they are. I don't, otherwise, you know, some of the lakefront stuff, like I said, unless we get somebody on their committee, I don't know how to do anything with that. But economic development, yeah, with those small cities, I'm trying to work out things with small partnerships with the aging unit to have some of the small businesses provide some meals when we can't. So that way it does keep some of the money down further in county. You know, each having some kind of forum or listening sessions, because otherwise our 9 o'clock in the morning meetings aren't usually where everybody can show up and participate. Or one of us going to each town or city's meetings and saying, hey, we want to open this up and have some kind of cooperative group and start just nailing things down. And that last piece is where I would suggest, you know, like working with Bad River and then pulling in ADC just, and during the pandemic, AADC helped out with businesses every place in the county and tried to keep everybody together. You know, offered lots of different trainings, different ways of pivoting for people to make other streams of income for their businesses. I don't know without having all of that underneath one nest, how we can ask somebody to pivot how their nonprofit works to handle housing. That would seem to be a housing committee, housing authority, housing something.
With that being said, it's perhaps time for me to chime in. This is the Chairman Mike Berlin, that I know AADC is working with Brian Miat, which is the tribal CEO out there. And he is also what he called the manager of the Superior Connections. And they've got, I'm not sure how many millions of dollars, but they are going to put a hard line into all the homes on the reservation. From Birch Hill down here to the edge of Ashland. They did have, when I was on the council, and I do believe they still have intentions of going down through Mellon, Marengo and Mellon with internet services. They are working hand in hand with Novato as well, because we have a, what do you call it, jurisdictional thing. They come up to US Highway to Bad River Bridge, and that's where Novato stops. And Superior Connection said, oh, well, let's work together. And it's a communication thing. But we may be looking at a resource here that is needing, and of course, AADC over here is perhaps not working quick enough, or maybe the tribe is not working quick enough or making action enough. We do have a new council here that was elected here in November. We have three new board members. I think they're going to be more willing to make decisions as opposed to our previous board. I'm happy about that. They do have a meeting coming up next Wednesday. I'll be at that. I'm usually at most of those council meetings. And when I raise my hand, they don't really know what I'm going to say. Even though I have the ear of the chairman and stuff like that. And well, with that being said, I'll probably be talking with Brian Miat yet this week. I already spoke to Dan Wiggins, who is committed to request this position here. I spoke to him 2 days yesterday. As a matter of fact, I just looked at my phone, 9:46 yesterday. I spoke to him, so I do have what he calls the ear of the council, even though I'm no longer on the council, but they respect me and what I have to say. With that being said, that's not a quick fix for internet down there right now, but it perhaps could be an alternative, a future alternative. Who's going to get there first? No one wants to go there because you don't have the numbers. And that's what this whole internet thing is it's a numbers game. And for, futuristic, bringing people back to the area, the service needs to be there. There's no doubt about that. It has to be there. Yeah, there's still spots there's no service. I'm driving down the road, I'm talking away, and all of a sudden, hello, they're gone. I'm out of the service area. Although it's getting better, but not quick enough for what we, would like. However, it's what it is. And I guess with that being said, I want to kind of go off on a tangent here a little bit with the subcommittees not communicating and the county board. I may be bold here in requesting that maybe we should consider what I had spoken to Dan here just a little bit ago, perhaps a working session amongst our subcommittees where we can collaborate. Because, one committee's doing this, one committee's doing that. And Dick Poopall is one very opposed to having an executive committee and a finance committee joint. That is just, however, I'm not quite sure how we could have a joint working session with the ongoing subcommittees and come out of there with a production or productive, having a productive meeting and being on the same page and going in this direction. I like a lot of what we all say. We all chime in all at the same time and we all have good suggestions. And how do we take those to the next step? We got to be able to collaborate somehow. I'm open.
How about a committee chairs meeting? A committee chairs meeting. That way, a committee made up of all the chairs. And then that way everybody gets to inform everybody about what's going on.
It would certainly be a starting point. I looked at the county comp plan. It's a couple of years ago, but it's kind of a thin document. And to me, the comp plans that I've seen with the city, although their cities was better a decade or more ago, the older one, because it was more thorough in terms of plans for achieving the things that they want. And now they get kind of thin and you go through this process. And to me, it doesn't leave much that's tangible. We're going to update the comp plan. And it seems that if we started now on the economic development piece, you could have the chairs together, start fleshing out some, topics, internet down county is an important issue. I don't know if anybody remembers, but in the election of 2020, the League of Women Voters had a question on how do you keep youth in the rural area. So I spent some time reading about that. And it's the same answer as how do you keep businesses there? You got to have internet access. You just have to, but it's for different reasons, the youth and the businesses. So we know internet is important, but then if we ask ourselves, who is taking the lead on this? Well, I can tell you a few that have spent some time on it, but I can't tell you if those efforts are coordinated. So if we say internet access and cell service are really important, do we have a plan that has a statement as to why this is important? So everybody that reads it, not just board members, but the public too, can understand why this is important and therefore the time and the resources that we would put on that. Do we have, a point person that's leading that effort? And do we know where they can look for resources, and are they going to look at this on an ongoing basis? We could start putting, those things together so that we have more specific things, strategies and plans and people and organizations that are literally tasked with those things. And then in our board meetings, some updates there. But I don't think we've really got this task. They're just people take bits and pieces, and that's the problem with asking the ADC to do everything is one, we don't really tell them what we want. And two, there's really more than any one group or organization can do. And therefore, when we write a check and hand that off, we are complicit in, washing our hands of that, so to speak, and we shouldn't be.
If I can just add, so having stakeholders at the table in almost every situation that I'm in, whether it's family, work, life, anything, is the key to getting things done. So if we're talking economic development goals, we've ratcheted down some things. We really need to bring Danny, our group, the head of AADC, Northwoods, all these people on a early year and have it as like a planning and like, so we have some goals that we can, the internet is a really good goal because not only does it align with where we need to be as a county, but it aligns with hopefully where we can get some grant money. And then that's when we can start putting, and I know it's not something we can look at because we can't afford it, but having someone that's looking at grants constantly for economic based things like internet, there's a lot of things. And we haven't even discussed this yet, but I would also like to make a comment. The future of energy is changing rapidly. And right now, I pay Xcel Energy whatever the hell they want to charge me because I got no options. And when the heat's blowing, I'm sitting there thinking, oh, it's going to be expensive. And that's really something that we haven't even talked about. But I think as a young person looking at how do we have some goals by 2030 in Ashland County for where our energy or electricity comes from, and holding our provider Xcel, which I have no idea even how we do that, but bringing them to the table. And again, these are things that we just need to bring stakeholders together. We've done a good job of identifying our economic development goals. And I think from this meeting, Danny, obviously we've asked you to do a lot, and I really appreciate all the things you're doing. But like you said, this is what's going to be able to define Ashland County going forward, is if we have good, accurate development plans. The community is engaged. They've been asked what's important to them, and we're trying to meet those goals. So anything I can do to help, like I said, I'm here for it, and I'm excited that we're having this conversation.
I do believe that if Dan Wiggins does come to the table, he is in the Energy Commission out at Baton Rouge at the present time. He was pretty instrumental with Bill Bailey over in Bayfield to get the solar panels that we have out at Baton Rouge right now. So we got about $2 million worth of solar panels, and it appears that Xcel Energy over in the little community of Cavill is putting up solar panels for individual homes. But that's a small thing there, but it's growing. The Baton Rouge tribe is continuing to look further into going into more solar, only because when I was on the tribal council as vice chairman, we had visited Red Lake over there. All the public buildings over there are all solar panels. So we're kind of taking a spin off from the Red Lake tribe over here in Minnesota to continue what we're doing out here at Baton Rouge. And one of the things I had made at the time I was on the council, I says, every time we have an outage on a Baton Rouge reservation, anybody east of that outage is out of power until that outage is repaired. Why can't we partner with Bayfield Electric to take that power from Birch Hill over to Saxon, so that when we do have an outage, we can have power coming in from the back end, and those people would not be out of power. Oh, gee, that's an idea. You mean to tell me that all these years, everything has been stopped at Birch Hill and nothing goes beyond that? Well, at the present time, it's a work in progress right now, and Bayfield Electric is working with the tribe. That may happen in 2023. I'm not sure.
Before Gary runs off, who provides power down in Glidden and Butternut? Xcel does.
Well, not always. There's Price Electric out of Phillips has some areas and the joke years ago was that Price Electric served your house, you want to move because they were down all the time. It's went through, but yeah, they're doing tremendous work over the years, and so it's a little better. Yeah, parts of even Butternut are served by Price Electric on one side of the road, XL on the other. Yeah, so just even solar panels down, in that neck of the woods, is a long-term investment. And then there's also jobs related to the maintenance and operation of that. It might be one way of keeping people in that local region. And then I know there's farmers in southern Wisconsin, it's kind of controversial down there, but they'll, have large numbers of acres converted to solar panels. And then there are people who think that's an eyesore because it's not farm crops, but, they get good rent and it's steady money. So just energy production in the southern part of the county, could be part of the strategy for economic development down there too. And then as far as XL Energy, Blake, I forget how many years ago this is. It's about 3-4 years ago. You have an option on your XL bill if you want to pay a bit more than otherwise so that the cost of your electricity is based on the rates of generating it through alternative energy, which is mostly wind power out of Minnesota, Dakotas. So we're paying, I think it was $4.52 more a month voluntarily. So we're reflecting the cost of alternate energies, and that helps XL to transition away from fossil fuels sooner than later. And then ultimately, hopefully bring the price point down, a generation from now.
So I was gonna bring this up during number 11, but I'll do it now. So next week, exec committee is gonna be looking at creating a climate change task force. So that's gonna encompass a lot of these issues that you've been talking about recently. UW, the extension office is already working on it, and they've been in contact with numerous people around the state to set up the bones of what we should be doing. And this came up through land conservation, but really the issue is much bigger than just land conservation. It's not just land and water. It's also our forest. It's also economic development. It's also health and human services, because with increasing temperatures becomes more health issues, be it viruses or be it algae growing in the lakes, so there's a whole bunch of highway, how big of culverts we build for future rain events. Do we make more porous roads going forward? There's a whole bunch of issues that really touch a lot of our departments. So the idea is to have some board members on this task force who want to be on and work on it, but also get some of our municipalities on board for their input, get the Bad River on board if they want to be, Northland if they want to be, community members. I mean, we want to open this up because this is really going to be part of our comp plan going forward. How do we address climate change and how do we make ourselves more resilient? So exec committee will be discussing that next week, and hopefully at the next county board meeting, we can actually vote to set up the task force and start setting up a task force. And we're doing, just so everybody knows, we're doing a task force. So it's because it's not really a standing committee. And so we can bring people in as they're needed, as opposed to like saying, land conservationists, you have to be at every single meeting. Well, no, Mary Jo has a whole bunch of other things she needs to do. So, this could be a situation where forestry is the one involved instead of her, so. Anyhow, I thought this was an appropriate time to mention that. So.
And with the broadband, we had Crystal Rhodey out of Northwest Regional Planning had sometime this year we were all passing out this year or last year, had passed out that whole tracking study of everything to see who had, as much input as we could get from across the county, because they were working on that. I mean, maybe we just need also some more input from them. We are paying into them also, aren't we?
To which organization?
Northwest Regional Planning.
Yeah, we pay them.
Yeah.
And yeah, Sheldon will be happy to help out however
So-
he can.
And I get about the internet. I have T-Mobile, which is like a random up here for most people. Sometimes I internationally roam. So I know we can have stronger things here because evidently Canada's got a really good tower someplace that I roam off of. I don't know how else I'm getting international.
Would it make sense, thinking ahead to a comp plan update that this committee starts pulling together information and goals for economic development? So we know Northwest, Laura and I both participated in that. I think it's 2 years ago already. Yeah, at least, yeah, it's 2 on economic development. So the internet, so we know Northwest Regional Planning provided some leadership there. We know Extension has spent some time on it. But we don't really know, I don't know offhand exactly where they're at and what, if anything, that we could do. But it would be nice to know that internet is an important issue, have a statement why, and then who's working on this, who we're going to stay in touch with, or what we might need to do to support that, and just start developing that, partly for the comp plan update, but then also, you know, so we're not duplicating thing or having these gaps or dropping the ball, so we're just more efficient with our resources and our time. But even, you know, it's like the solar, you mentioned, you know, Bad River got, you know, money for that, and it's a good thing. But then I think it makes me think about Down County, and now I made a note about, you know, as electric vehicles come into being, you know, having land out in Mason, we just upgraded the power at the Mason Post Office, which my mom owns. We buried a line there and put in a new 200 amp panel in anticipation of them having electric vehicles someday. But in the process of working with Xcel, you know, I asked them, are you going to have to upgrade a lot of power lines? And the answer they anticipate is a yes. And so thinking back to Blake here, you know, the cost for Xcel, if there were some solar capacity installed throughout the county that was more local, it helps to create jobs, brings in some income to people, but it might also reduce Xcel's cost to operate if some of that electricity was generated more locally than otherwise, as people transition to electric vehicles. And then it's not lost on me that there's not, you know, gas stations in a lot of those places, as Gary was mentioning. And I had a laugh when he says, you know, people are driving 22 miles to get gas and groceries. Yep, that's my life out at the farm at Mason. It's the same thing. I know that. You know, so you make those trips, but the electricity out there may become more important to the rural areas as people move to electric vehicles, because they are further from those gas stations. They might transition sooner than otherwise.
We'll see, and that's where I think that also emergency management can play in, because as we keep having more climate issues, then people that are in rural areas are going to have more issues. Also, BART has been helping Bayfield County put in electric chargers. So Bayfield County has put some money into that too. There's something else there. But you know, all these pieces, I think people are working on it. Oh, I know, the comprehensive plan. Basically, the comprehensive plan is almost just, and it actually derives from input from the county board, but it's kind of changed the state, because the state sends out a template. And most of our stuff that's on there is basically the template stuff with Ashland County plugged in the spot. When I first moved here in 2015, I got the copies of the city and the county plans, and just, I'm not impressed. I think we can do better, and I think we should be leading that in working in collaboration with Extension to make sure we get the data we need and the input from the citizens, to make sure that it's across the board that we're hitting the right spots.
What I'd like to do is bring this topic, item economic development goals to an end. Only with saying that, I think we need to collaborate with the Bad River Tribe more closely, because we're going in the same direction all the time. We work with Northwest Regional Planning, and we have a board member there as well. And right now, with millions of dollars that they have for Superior Connections and the upgrade of that internet service, in addition to the $48+ million they got in the CARES Act and the ARPA money, a lot of that spin-off is coming here in Ashland County with our local contractors. And I think a better job could be worked out if we had worked together through some type of collaboration. And currently, we don't have that. And I talk to the executive out there all the time, Brian Miat. And I'd like to bring him in at some point in time. I'm not sure to the county board, but at least to us here, to get a start. This is what we got, this is what, it's in the work, da, 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 da. And with that being said, we're ready to move on.
Mr. Chairman, can we just make this agenda item a standing agenda item for next meetings?
Yes,
That way, these conversations can happen.
the goals.
And if there's nothing to discuss that meeting, just skip the item.
Yeah.
Thank you.
Jail bank account procedures.
Okay, these next two items are recommendations from our consultants, Mike and Steve. Just tightening up the procedures and to keep cash safety, handling safety.
Do we need to,
Yeah, if you could approve them.
Can we just ask one question? So I wasn't here when there was an issue with the previous, I think there was some transparency issues.
Yeah,
An account that the jail has, like, let's just say they get a check for 1,500, or well, let's just say $5,000 for a bond for somebody that is put in jail. They take that check and they deposit it that day, right? Next day, procedures?
if it's $5,000, yes, they should take it to the treasurer right away. They also have a lockbox thing at the jail. I don't know exactly what you call it. Laura, do you know what I'm talking?
kind of like a reverse ATM. So
Right.
when somebody comes in with 320s, 210s and a 5, when they come in, they slip them in this machine and it's kind of scans it all in and tracks it. So-
Yeah.
And there's no loose change, no putting it in an envelope, no sticking it in a
Right.
file box or anything. It goes right into that and then that is taken out and deposited.
Yeah, and that machine keeps track of everything that goes into it. Also, there's a receipting system in place where when you get money,
Yeah.
you have to issue a receipt. So that money gets tracked in the system too, that way. But yeah, if larger amounts come in, the jail should be taking that money straight to the treasurer's office. When they're just getting smaller amounts in or it's going into that machine, they do it weekly. But,
So if we were to, let's say, there was an inmate that got hit with a bunch of fines that were outstanding, as well as other, let's just say, child support payments, whatever. If they put money into the account under that person's name,
right.
would it go to those fines and that child support payments right away, or would it, is there procedures around that?
Well, those are state statute governs those procedures.
Okay.
So yeah, if somebody is paying a fine, they should be going to the clerk of court's office to pay that fine. If somebody owes child support, they should be paying it at the child support office. Or the clerk of court's office if the judge is ordering him to pay him or her to pay at that moment. So yeah, as far as taking money from individuals to pay fines, we can only do that under court order.
Okay.
Now, if somebody comes in with, say, $100, and they make a bunch of phone calls, that money is deducted from their amount. Or if they buy something at the commissary, that toothbrush or whatever they buy, a bag of chips, that's taken from that account. But the money is refunded to the inmate upon release in the form of a debit card.
So in the first paragraph of that document, this is sort of related to what Blake asked. To me, at least, it isn't clear, but maybe it is to people that work there. So it's used for that inmate, but when they're released, how do they know that every obligation that inmate accrued has been paid and therefore the balance? Because it really doesn't talk about a process to give that person that what's left there.
Right, well, it's not, I mean, the purpose of this account is not to collect fees and fines.
But
So when people are in the wellness court, they have to pay, there is an assessment fee they have to pay for that, and that does come out of their cash. But we're not here to collect fines for, I don't know, pick a crime, DUI. That's not what this account is for. That money gets paid to the clerk of court's office, and they pursue that cash through legal means. Generally, it's using the Department of Revenues.
Yeah,
so,
what this is to track the cash that comes into the jail when
Right.
someone is taken in, to make sure that we know every step that cash takes.
Right,
And it says on there what it is. It's that, where'd it go?
and the Stellar
Stellar
Killer is that
Killer.
machine.
And the money management system. This is to make sure there is a step process for everything that comes in there, that somebody doesn't accidentally misplace one dime from it, because it goes into there and it is an electronic fund account. And they get to see what comes out of there and stuff when they leave.
Yeah.
They know if they have to pay that assessment, it comes out of there. They get told what comes out of there if that's what they came in with.
Right,
Or if somebody deposits money for them to do phone calls or use Zoom to see somebody, or a commissary, like you said, that kind of stuff. But it's not you have a traffic ticket that you didn't pay for, we're gonna
Yeah.
take your $10 or
Uh,
whatever.
so,
yeah,
This is
clerk of
just a
courts pursues
procedure.
that, and they usually go after tax refunds.
so, but the part for the use for the collection and disbursement of cash bonds. So,
This is in direct response to the incident that happened before I got here.
yeah, so the bonds part there, so if someone's being released, if there's any money the county should be keeping related to the bond, the county will have kept that, and then any balance left is being given to the person when they're released.
This isn't for their bonds, the bond.
It's not for the
court
no.
system.
That goes to the clerk of court's office.
This is just for the jail.
Yeah. So if they're participating in wellness court, they have to pay a fee. All right, it could be $5. It could
So
be
I-
whatever, and that will come out of that money. But yeah, if they're buying a toothbrush, that'll come out of that money. If
So
they're-
I don't understand in the purpose paragraph. The account will be, also the account will be used for the collection and disbursement of cash bonds. I don't understand that in there and how that's managed. And then I don't understand what process there is for the person upon release getting whatever balance remains.
The balance is their cash brought in, the cash bonds.
All right, people sometimes pay the cash bond to the sheriff's office.
Yeah,
Like you're going to pick up a loved one. And you have to post $100 bond or whatever it is,
sometimes $100.
or I'm saying $100.
Seriously, there are people in jail for $100, so
But-
they take it to the
Because the
to the
sheriff,
secretary up front and give that money, and that money is tracked in this system too.
right, and that money then gets transferred to the clerk of court's office. What will happen is the sheriff's department will deposit it in the bank, but the receipt that comes up, the clerk of court's office will know that they got the money. And they have to be contacted to clear it off the record to show that it's been paid. So that's what that's for. This is really just to track the money.
So the next or third paragraph, there's a bit on disbursement, but then what's not clear to me is, so when the person is released, the county's kept whatever they need to, for disbursements to the clerk of court and other jurisdiction. Is there a process then where whatever balance is left is then provided to that inmate?
Yes,
That
the
person-
inmate gets their money back on a debit card.
So where am I?
Right here.
So it will be made by issuing checks or debit cards from the bank account. It doesn't say it goes to that person.
That's what it means. It goes to the person.
Okay, maybe it should have two more words in there.
Because the next sentence says what goes to Ashland County,
Right.
but it also doesn't give any sort of timeline in terms of when this process will wrap up. And I'm kind of noticing that because that seemed to be an issue with the way things were before. So there's no by the 15th of the
Oh,
month, by the end of
It's
the
the
month.
next,
At the bottom,
at the next page.
at the bottom, goal of the sheriff's department will be to complete this monthly closeout process by the 15th day of the following month.
So they're supposed to be, so they're gonna have to close, they're gonna have to close their books every month.
Yeah.
Just like a business would at the end of the month.
But that doesn't, to me, when I read that, it didn't specifically say the person being released is gonna get whatever balance they are.
Well, they're required by law to get that money back.
So there's this report and whatever, but where in there does it say that the person being released is actually getting the balance? I guess I just didn't see that the way I read it, and I'm not as familiar with all of this as some of you.
All right. Well, we can amend it to make it say whatever you want, Pat.
I guess I'm just looking for something that says within X days of release, a person will receive whatever balance is due them. I just,
Well, it's not released. It's just once a month they will do this. So within, I guess if they get out on the 17th, they're not gonna get their stuff back until the 15th of that next month.
Well, with this, actually, the month end closeout is the account has to be closed out. Inmates get their money when they're released. So if you're in jail today and they release you today, all your fees are gonna be taken out and then you're gonna get a debit card today with your leftover cash.
so a sentence or
Because,
two, sentence or two saying
well,
what you
that's-
just said
that's state statute.
would,
And the
So-
purpose behind that is so people aren't released from jail without any money, with no way to get home, no way to buy food, no anything. So they're giving their money back minus the fees.
so in there, two sentences to the effect of what you just said would answer my question as far as
Okay,
what's going on, because to me, my read was there's no indication that it's actually being given back. My concern was it just sits then, and there's nothing that compels the county to, in a timely manner, return
right.
that money, and to know that the county has received whatever the counties do.
How about at the end of disbursements, like a sentence that says,
If we just.
inmates shall receive shall have their funds returned as dictated by state statute. Because we have to follow state statute on all these processes. So if that way, if state statute changes, we don't have to change anything.
And you're assuming that whatever staff are handling things would understand what state statute means?
Well, yeah,
if they're-
that's their
that's
job.
the
Dennis.
jail. You know.
All right,
Yeah,
well, I haven't been there, so I don't know about all this.
You can go anytime.
There was a
Yes, it
comment,
is. Yes, it
there
is.
was, there was a comment posted that we have families that wait for weeks for child support bonds paid at the jail. Bonds should be brought over to the COC treasurer daily or end of day, in my honest opinion or opinion. So that's kind of the question that I was kind of getting at was if somebody were to post a $5,000 bond, they had $1,000 that they were back on child support. Would we offset the 1,000 and give them back 4,000 when they got their money, or would we give them 5,000 and then still be in arrears for the 1,000?
That really depends on what the court wants to do.
Would that be commingling funds if you kept that 1,000 out from an accounting perspective?
The court doesn't say to do it. It could be a legal issue if we try to keep out money that's
Right.
not court mandated.
Right. Yeah, if child support knows that there's somebody in jail that has that bond, they should ask the judge or the family court commissioner to allow them to keep that money.
Yeah, I think this is two different places
Yeah.
on this, because I think this is just making sure that because before the issue was there was a few different accounts, we've brought it back to one account. And now we have a purpose, a way of collecting that money. This is to take the money in from people as they come in, keep track of every dollar of it, turn it into an electronic account. And then to disperse it where it needs to go at the appropriate time. But leaving this more general, or putting all disbursements will be made out. If there's something that's between departments, I would think that needs to be handled different. This is more of a keeping track of the
Yeah,
cash. I mean, I see them as two different places.
this is just a cash handling procedure,
Yeah,
really.
yeah,
It's not like saying who gets what, when, where and how.
no.
Is there some kind of code on the money when it's entered? Because it's serving multiple purposes. So I'm wondering if it's coded like this is for
Well-
my cash bond versus this is for.
The jail is
canteen.
not supposed to know, how is the jail supposed to know when somebody comes in, you know, with cash? You know, the court tells them that, says that you get bailed out at, it costs you $1,000 to get bailed out, so they bring $1,000 down. You know, the jail is not supposed to know what that money is. That $1,000 is really to ensure that the person shows back up in court. It's not to do anything else.
And now with our new accounting system, it's kind of a push of a button transfer in the
Yeah.
accounts. Because we're all on the same accounting system now.
So you just said, okay, let's say someone comes in, here's $1,000 for the cash bond. Well, how does the jail staff know it's for the cash bond versus Joe really likes his
Well-
candy bars out of the vending machine?
Well, no, they come in and say, I'm paying the bond, and they can get the bond amount. But the bond is there at the order of the court to ensure that the person shows up for their court date. It's not there to pay off a child support. It's not there to pay off a ticket. It's not there to do whatever. It's a bond held by the clerk of courts to ensure that people show up back in courts. I guess we're confusing multiple different
There's
issues.
Lots of.
This is really just an accounting
This
issue
is-
to ensure safe handling of cash.
But what I don't understand then, when money is put in, is it somehow quoted or recorded so that it's clear it's for one purpose versus the other?
If it comes in for a bond, the money goes to the
Well,
clerk of
this
courts.
one, the account name is for Ashland County Jail. This is jail money.
Yeah. Yeah, if they get bond money, they're supposed to give it to the clerk of courts right away, so they can release the person. If this is money if John Smith, to pick a generic name, gets arrested and they have $100 in their pocket, this money goes in there.
Yeah.
And then the $100 is accounted as this is John Smith's money. When John Smith buys a toothbrush or a bag of potato chips, or makes a phone call, that money's deducted that expense is deducted from here. And then the balance is returned to John Smith when he gets out of jail. But this is not to hold for X fine, whatever the fine is, or child support. This is literally just to keep track of the money in the jail.
So that's,
And the next item is just about cash handling in the Register of Deeds office. This is really about setting up safe cash handling procedures.
so someone comes in and says, I got $1,000, Dan's in jail, this is for Dan. And how does the person depositing this or recording know whether it's for Dan to use for commissary and canteen versus, oh, I meant that for his cash bond?
Well, that's up to the person making the payment ultimately, isn't it?
So then is it recorded in some way to indicate what it was so that the inmate then doesn't use it for,
Well,
canteen?
I think the inmate's gonna want to get out of jail if that's what the money's for.
But
I mean, if you're bailing somebody out of jail and you're bringing the money to the jail, you say, I'm bailing John Smith out. They know that it's for a bail. I mean,
When they come to the window, they're gonna say, this is for him to get these things, or this is for his bond.
yeah,
So it seems to
they'll
me that there should be a
take it.
way of recording what that was intended for.
In the
Well, they will.
computer. It's in the accounting system.
But
They're
we
on
get-
the accounting system.
So
They'll
the-
enter it in.
There's a different code for the purposes.
There's lots of.
There's a
codes for
different
lots of
code, yes.
purposes.
Or as long-
right.
I think we're all human. The people at the sheriff's office are obviously human, so as clear as we can be is the best, but I get it now. I apologize for some of the questions. Thank you,
Oh.
Danny.
Yeah, and the jail is seeing this too, so they understand what the intent is too. And the sheriff and the deputy chief have seen it. Everybody understands what the intent is
And this came
from Mike and
as-
Steve.
from the fiscal people. So the ones that are setting up the whole thing in the background, so.
And just like the next item too. Go, motion to approve.
I'll make a motion to approve the Ashland County procedures for establishing a bank account for the jail at Superior Choice Credit Union.
Excuse me. We have a motion on the floor, looking for a second.
This is Pat, I'll second.
Pat seconds. All those in favor say aye.
I,
Aye. Opposed, motion carried. So this other one here with the Northern State Bank,
It's the exact same issue, only with the Register of Deeds office.
And I hate to ask you, can we look at the last paragraph on that one? And scroll down a little bit more if you would, please.
next page. There you go.
So this sentence here, I struggled with. The goal of the Register of Deeds Department will be to complete this monthly report. So let's say we're talking, December right now. By the first business day of the following month, which would be January, after outstanding deposits from the current month. So if they're working on this in January, which then becomes the current month, does that from the current month refer to December, the month that they're reconciling this with, or is it from January? Because when they're working on this in January, the current month is January, after are received into the account. So I'm not sure if the current month refers to,
Current month refers to December. Until the until a month is closed, it's the current month. Until a year is closed, it's the current year. So when you say current, you mean the open month or year.
so why in that second line, it says from the current month, would it make sense to say from the previous month?
No, it wouldn't, because under GAAP, the current month means the accounting period that's open.
Who knows get best?
That's what it means when the current month is the month that is open.
It's very accounty how they wrote it.
This is totally an accounting thing. Blake, do you want to chime in on what current month means in accounting?
No, I mean, you could tie your tongue on this one, but let's just take it for what it is and move on, I think, ultimately.
Is that in the form of a motion?
Blake, did you make a motion?
I'll make a motion, yes, to approve these procedures.
you have a second?
I'll second the procedures for establishing the bank
Laura?
account for the Register of Deeds.
All those in favor say aye.
I,
Motion passed.
Okay, investments are self-explanatory. It's in the packet. Sales tax is in the packet. I will say we're still doing better than last year. We're up by about 60 grand.
you see, we took a dip though. Now
Yeah,
have-
we did take a
now we
dip in
have red
October.
numbers.
I've seen the November numbers and they're up. So. Which is weird how I can get November numbers in November, but never mind. It's another story. So they are up. So we expect to finish the year higher than budgeted. And as a reminder, we did not budget for 23 any more than this. We budgeted this year because there's a recession. We expect to take a hit, although that's looking less likely these days. So. And then for my updates, I already told you about the climate change thing. I told you about the already about the USDA's Rural Partnership Network. So that's what I had, and we've already talked about it.
Did you ever get an update on the building?
The building, yeah, we're gonna have to put that out for bid. It needs to be tuck pointed around the entire building, and then the I-beams and some of the I-beams in the roof need to be resoldered.
So we had an inspection on our other building, or not, yeah.
Yeah, we went over, yeah, and that was, God, we went over that back in September, was
Potential
it?
buyer.
I'm sorry, we went over that in September at PPLE and exec. So we were waiting for the budget to pass, so we knew how we were gonna pay for it. So now we'll put it out to bid and hopefully get a project done this summer.
I think he means the 514 building. with
Oh, the
five
514
offices.
building, I'm sorry. Let's see, what time is it? Dave is meeting somebody down there in 20 minutes is thinking about purchasing the building. And that's something that came through the mayor's office.
Oh,
So we'll find out. If they want, I told them that, you know, we have issues with the wall and they should take their own contractor down and assess it themselves. So. Just, we don't want to hide anything from you, so go look as much as you want and see what you need to do.
Meeting date,
I'm sorry.
meeting date?
Sometime in January. Can we come up with that later? Uh, Mid-January work?
The second week of January, I'm traveling for work, so
19th, maybe?
yeah, that'll be better.
Yeah, because I'm in Madison the following week for a WCA thing. Yeah. And then if we need to change it, we'll let everybody know if we need to change it.
Motion adjourned,
I'll make that motion.
second,
I second that.
all those in favor, say aye.
Aye.
Aye. Motion adjourned, thank you.
Thank you, everyone.
See you, Blake.
You guys.